and join me for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, and you may be seated. That will move us on to roll call vote of the trustees. Joe Raffiani. I saw him. He looks like he just stepped away, so I'll come back to him. Jana Hafer.
Present.
Michael Leo.
Present.
Scott McCullough.
Present.
Thank you. Russ Hall. Is Russ on yet?
Present.
Oh, thanks, Russ. See you. Jennifer Hoffman.
Present.
Brian Yates.
Present.
Hi, Brian. Is Tanya Ludwig on this afternoon? Tanya is excused, and Joe Raffiani is back. So if you would just acknowledge by being present.
Present.
Thank you, Joe. And the chair is present. And that moves us on. Before we get into communication from the public, I would like to make a couple announcements. And the primary one is that on August 17th, we will reconvene our August regularly scheduled board meeting in the Lincoln Center boardroom. Superintendent Upp and I have chatted about this on and off for the last month as to when we would get back into the boardroom, being able to get together with our fellow board members in person. And we had made the decision that October 17th will be when we will reconvene. It has been a very positive outreach to our community through Facebook Live. Our last board meeting in July was viewed by almost 8,000 people, and Superintendent Upham shared that in combination with the meetings that we've been having and the live broadcast he's been having, we've had about 1 million hits. So we're very, very encouraged that folks are able to connect with us. I've spoken with our IT specialist, Mr. Branham Newfer, who's done a fabulous job navigating this whole process. And he is going to be working to see if we can have a linkage with Facebook Live or some entity where we will be able to broadcast and we'll be able to continue to connect with our community. We will be wearing masks. We will be social distancing. We do invite folks that have comments that they would like to make to the board to come down to the Lincoln Center boardroom. The audience will be limited in consultation with our county health officials, and masks and social distancing would be required. And just as a friendly reminder, as we move into communication from the public, when we do our virtual meetings, we do accept public comment on our Billings Public School website. We start collecting comments 2.5 hours before the meeting. We run for 2 hours, and then a half hour before we stop the comments from coming in so that our clerk can review them for any privacy issues. Public comment is a great opportunity for our board to hear from the public. It's an opportunity for them to express their opinions directly to us, and we very much appreciate hearing from our community. I do also want to remind our community that the board's practice is not to respond to public comment, but I do want you to know that we all appreciate hearing from you. So with that, I will ask Mr. Van Nys if we have communication from the public this afternoon.
Yes, Madam Chair, we have 21 comments. So we'll go ahead and start from the top here. The first is from Megan Heenan at 2325 38th Street West. Dear Mr. Upham and board members, having yet to see the draft to be presented, I'm only able to assume that it is one of staying the course and offering either complete in-school learning or a completely online platform. Both of these seem like the worst possible options. Witnessing what is happening in our city with a mask mandate, I'm not confident that all the teachers, much less students, will take the need to wear masks seriously. If there are no punishments for noncompliance, clearly many students and possibly teachers simply won't comply. Unfortunately, too many people see them as a political statement and not as a means to keep each other alive and healthy. Classes being taught outside is good in theory. Fresh air, we know, slows the spread of the virus, but realistically, this is not an option in Montana. We will quickly change from miserable 100-degree days to windy, freezing days. Not to mention, if we are setting up, taking down canopy tents, what outdoor space then is left for gym class and recess, all socially spaced, of course. Ignoring the practicality of teaching a class outside, I'm certain most teachers would agree that there is not much quality learning happening with all the distractions outdoors. Online learning that only covers graduation requirements does not work for us. Looking at my senior's schedule, not one of her classes would even be offered under that plan. Offering only bare bones classes essentially punishes kids who are working hard to get into a good college. While I appreciate the headache of trying to staff for online learning and in-person instruction, asking parents to commit for a year is unrealistic. How can we know? A year ago, we certainly didn't know what last school year would look like. What if the online platform is failing? We are supposed to commit to a year of it? Realistically, this needs to be a semester commitment, and we can revisit it in the winter. But most importantly, I looked at the teacher survey. I read all the comments from the board meetings and the Facebook Live chats. Parents, teachers, and students alike are begging for a hybrid platform for this school year. Mr. Upham seems to dismiss this option completely by answering it with a question. What are they doing during the hours they aren't in school? My answer is this: whatever they are going to do anyway, but in much smaller groups than they would be if they were all in school at the same time. In our family alone, a full day schedule puts my kids sitting in classes with 565 kids every day, and that's not counting hallways, lunches, recesses, etc. The hybrid model puts them in class with 150 kids twice a week. The difference in contact is not insignificant. Missoula has laid out a detailed reopening plan with phases and a hybrid schedule. Bozeman is working on a plan with block classes and cohort learning schedules. Yellowstone has more than double the rate of active COVID cases of any other county in Montana. We are far from getting our rate of transfer under control. As of today, we have 537 active cases in Yellowstone County, which is over a third of all active cases in the state. I feel that under the current conditions, putting all the kids back in school full-time is dangerous and quite honestly negligent. Please push for a plan with more consideration for the Missoula hybrid schedule and an online platform that is not merely an afterthought or punishment for those who wish to use it. Please listen to the teachers, listen to the parents, and vote for a plan that ensures their safety first. Please adopt a plan like Missoula's. Sincerely, Megan Heenan. Okay, next comment is from Verena Miller at 1249 Matador Avenue. The comment is, please address how learning at the Career Center will work with all three high schools attending classes at the Career Center. Can students attend the Career Center classes if remote learning is chosen? Also, what will the quality of learning look like for remote learning? Will honors classes be offered, and will the requirements be as extensive as in-class learning? Okay, next comment is from Kate Brandt at 2020 George Street. Comment is, will the schools be lending out laptops to families that have opted for remote learning? Next comment is from Jordan Gadis at 2231 Willowbrook Way. Thank you, Mr. Upham, and to the school board for hearing my question. As a parent of an elementary school children, I'm wondering if you will consider changing the requirement that parents select either online or in person for the entire school year, as this seems like a huge commitment when everything else regarding the COVID-19 pandemic appears to be ever changing. In the school district's reopening plan, everything is subject to change in a moment's notice. Still, parents are having to make a difficult choice on whether to keep their children home for an entire year without the flexibility of change happening elsewhere. I will admit that I feel fortunate being a parent who can keep my children home, as I know a lot of parents who do not have a choice. I believe all parents want to send their children back, and that is why I hope this requirement gets reconsidered before implemented. Schools need a certain number of students to enroll in online learning to be able to effectively and safely distance children at the schools. If this lengthy requirement influences parents to send their kids rather than keep them home, all students will have their safety compromised in schools that do not have the room to distance their students physically. I do believe some commitment is needed, and I have seen that other districts in our state are allowing parents to choose by semester or trimester, and those options seem much more acceptable. What if there are highly effective therapeutics by November or December, or maybe a vaccine in January? These circumstances would change the mind of many. Okay, next comment is from Daniel Johnson at 223 South 39th Street. I feel truly and honestly these questions should be addressed if the primary concern is health and safety of staff and students. I am happy to be contacted to provide sources for all of the studies I reference. Number one, the APP recommendation is pretty clear that school reopenings are only recommended under strictest social distancing guidelines and no community surge. Yellowstone County is a hotbed at the moment. Why do you think it's wise to reopen given it flies in the face of about every exception these organizations suggest? Number two, recent studies out of Israel and South Korea suggest that high school students are 100 times more susceptible to the virus in a school setting than in the environment at large. What precautions do you think we are taking these countries have not to reduce that risk? Sorry, that's the way it's typed there. Number three, your teachers regularly appeal to either the Education Foundation or crowdfunding in order to gain access to necessary instructional materials. What do you think about your plan instills confidence in the district given a lack of overall available funding for instructional needs? Number four, will employees be forced to use discretionary and sick leave if they contract COVID in a school with positive cases besides the teacher? Number five, what instructional tools are you providing access to in order to deliver instruction? What PPE? It is a lot harder to deliver instruction through a mask and without a mic, and students should not be within 6 feet of a teacher without, say, a plexiglass barrier. Number six, how are class sizes being reduced to allow for social distancing? Number seven, how will equipment be properly sanitized if we are on a normal schedule? Number eight, best safety practices would indicate that outside of instruction, classrooms are little to no talking environments. What resources, if any, is the district providing access to or training for to encourage online collaboration and instruction? Number nine, speaking on that last one, how are all students getting a device? And number 10, Superintendent Upham talked a lot about social, emotional, and physical health of all involved. What is his reply to the 55% of respondents to the staff that feel opening schools is not the correct course of action? Are we ignoring the mental health of those people? What resources does the school district plan to offer to help what I am sure for many feels like a violation of their trust and emotional and physical well-being? And the next comment is from Katie Gunzler at 1009 Aronson Avenue. Has the district considered a hybrid option to limit the number of students at the school at any one time? The next comment is from Gabriel Triglaun at 424 South 38th Street. Comment is, I think that a remote learning option should be available for students. Not every parent is comfortable sending their children back to school during the COVID-19 pandemic. I do not think the measures proposed so far are adequate because the main thing that seems to be missing from these plans is how to deal with noncompliance. Also, I don't know how anyone can expect small children to A, stay away from one another. They just don't do that, and schools don't have the space for this anyways. And B, are going to keep a mask on their face for the majority of a 6+ hour school day. Also, how do you keep playgrounds sanitized? Maybe some kind of spray for the warm weather months, but what about the winter when any kind of disinfectant spray may freeze and make the playground safe in an entirely different way? Seems like some kind of remote learning option needs to be implemented because there are too many unknowns and variables when considering how to safely send children back to school. My children will not be attending school, so if you refuse to offer a remote learning option, my kids will be homeschooled this year. Next comment is from Jen Cleland at 325 29th Street West. From previous discussions, it seems that there are a limited number of distance learning spots available, and understandably, those with serious medical needs should get first priority. What sort of documentation is needed to obtain those spots? Is every parent who requests distance learning for their child going to have that request fulfilled? And if not, what sort of system is in place to select which child receives distance learning versus in-class instruction? Or is it simply that every child without a medical exemption for distance learning is expected to attend in person? For young learners, kindergarten through 3rd grade, how will distance learning look this year? Will there be more live face-to-face instruction time on devices? Are school counselors available to all students in person and distance learners? Inevitably, our students will know someone who becomes ill and will need support. Okay, the next comment is from Shannon Larson at 334 Future Circle. Last night, I spoke in front of a socially distanced group of 10 people. I was wearing a mask. It was difficult for them to hear me, even though I was speaking loudly. My question is not about wearing masks. I find that a necessity. It is, will you be providing microphones for teachers in classrooms so the children can hear them? Second question is, how small of cohorts are you planning? And the third question, if I decide to have my children learn from home, will they be challenged enough? My kids are in the Quest program and need it to be hard or they get bored. Okay. Next comment is from Heather Brown at 159 Erickson Court. I am encouraged that you are planning to reopen schools to live learning. I am also encouraged that the Montana High School Association has provided guidance for a safe start to our activities. I am hoping that you will allow fans to support and encourage our student athletes. If we can have up to 3,000 people at a fair, there is a way that we can support the kids in sports. I thank you for all your efforts and updates during this unprecedented time. Okay, the next comment is from Samantha Dominguez-Hurt at 3224 Granger Avenue East. Comment is, I don't understand why temperatures are not going to be checked before entering the school buildings. It would be much safer for everyone involved. Parents without alternative childcare will continue to send their sick children to school. It happens all the time. I would send my kids to in-class learning if taking temperatures were mandatory. Otherwise, I cannot risk the health and safety of my family. Okay, the next comment is another comment from Gabrielle Triglown at 424 South 38th Street. Comment is, another point I'd like to make in favor of remote learning is regarding safety. Schools are responsible for the safety of every student and employee. What happens when a child tests positive and possibly spreads this virus to other children? What measures are in place to deal with a potential school-wide outbreak if one should occur? Who is held responsible if a child is hospitalized or even possibly dies from this virus? Just because it is less likely to affect children doesn't mean that it doesn't happen. By sending students into an environment where they risk potential exposure to a deadly virus seems inherently unsafe and irresponsible if you claim that every child's safety is a top priority. Remote learning may be inconvenient, but in the long run, it may not cost the school district a fortune when a parent sues in the event of a serious illness or death related to COVID-19 and, more importantly, keep more people alive. The next comment is from Kirk Jensen at 3992 Parkwood Drive. Comment is, if the school district is planning to continue music classes this fall or year, especially band classes, please address specifically the steps the district will take to protect the safety of students and teachers in those classes. It is not possible to wear a mask while playing a wind instrument, and band rooms are generally are not large enough to permit anything close to physical distancing. Normal band room arrangements with students in relatively tight quarters, not wearing masks and blowing into their instruments and at each other would seem to put all students and teachers significantly at risk. How specifically will the district address this? And please do not simply say it will be safe or we will do what we do best, since these are not answers. Parents need to know specifically what the district plans to do in advance so they can know how to protect their children who had previously registered for band and other music classes. If parents are concerned about the steps the district will take, will the schools work with students to reschedule them in other classes? Thanks in advance. Okay. Next comment is from Ann Hall at 729 Highland Park Drive. Comment is, as a retired SD2 teacher whose daughter teaches in the district, I have a unique perspective on schools opening this fall. The next regular board meeting occurs a week before teachers return to their buildings and 2 weeks before students fill classrooms and hallways. Therefore, the August 17th board meeting must occur in person at Lincoln Center. Members of the public must be allowed to attend because they not only represent those you are serving in your positions, but they also create the physical environment staff and students will soon enter. Masking and social distancing should, of course, be required. If you are not willing to hold the meeting in person and with the public present, consider your reasons and how they also apply to adults and children going back to school soon. If you are willing, consider the precautions you hope will be in place as well as the following. Will you feel safe returning to your homes and families after the meeting? Will you feel safe visiting elderly or at-risk family and friends after the meeting? If not, after how many days would you feel safe doing so? How will you monitor and ensure everyone in the boardroom adheres to social distancing and masking guidelines throughout the meeting? If more people want to attend than 6 feet of social distancing allows, how close to you are you willing to let members of the public sit? Will you feel safe passing through the hallways of Lincoln Center with members of the public before and after the meeting? Will you feel safe using the same restroom members of the public use before and after the meeting? Will you feel safe waiting in line with others to wash your hands, ideally, or use hand sanitizer after the meeting? Would you feel comfortable spending hours every day in the boardroom as multiple groups of up to 30 people rotate through hourly without cleaning and sanitizing between groups? Would you feel safer if everyone's temperatures were checked before they enter the boardroom? Would you feel safe eating in the boardroom after multiple groups have rotated through and during the 3 hours the virus would stay alive in the room's air after those groups have departed? Would you feel safe sharing materials, example, paper, writing utensils, digital devices, with other members of the board and the public as needed? Would you feel comfortable returning to the boardroom the next day and each day after that for additional meetings if cleaning and sanitizing weren't possible overnight? If you are at greater risk of developing a serious illness from COVID and the board still meets in person, are you willing to get a doctor's note to allow you to participate remotely? Teachers and students want to resume in-person learning, and they do not want to do so in an unsafe environment. As you listen to today's draft proposal, consider whether the superintendent has addressed and planned for the above realities. Thank you. Okay, next comment is from Kirk Jensen at 3992 Parkwood Drive. Comment is, in the last school board meeting, the superintendent indicated that remote learning options would be less robust than in-class options. It appears he meant that the numbers of courses that would be available would be limited, though that was not entirely clear. If certain high school courses are not offered remotely, for example, AP and honors classes, can students take those classes through a different accredited online school and use those credits towards graduation? I strongly urge the board and the district to permit this. Otherwise, you are forcing students to choose between taking the rigorous courses they need to prepare for college or attending a school in person when they have serious COVID-related concerns. And if the district will not permit this, taking a more rigorous class schedule online would prevent the student from graduating from his or her local high school. And that is not a consequence students should face when they are taking steps to enhance their education during this challenging time. Okay, next comment is from Tara Morehouse at 1340 Claim Jumper. I am concerned about how we have the fair here with people going to be coming from all over, and a week after the fair ends, we are supposed to send kids back to schools. Why can't there be a phased reopening of school? For instance, start with distance learning and move into classroom when the numbers do not keep going up. I have 2 kids that are going to be in middle school, and I am super concerned that there's going to be a spike after the week-long fair event in Billings. I just don't want to see teachers put at risk or my children. I just feel like bringing them back to school only to be divided and isolated into groups sounds awful, and that we as a community need to be more cautious with our children, especially when I heard from a nurse that a lot of COVID positive or presumably positive cases she has seen recently are kids. Okay, next comment from Mike McKinney at 1003 Yale Avenue. Would you consider starting the year online while observing the rest of the country open their schools? Seems to me that waiting 6 to 8 weeks makes more sense than rushing to open the doors only to close them again in a month because the virus ran rampant through our schools. Next comment is from Brandy Hartman at 2912 Cactus Drive. We have serious concern regarding reopening schools, with the understanding in mind of everyone's health and welfare included, but specifically the children's. Their social and mental health needs with the lack of social interaction should be greatly considered, but at what cost? How will the district county respond when there is even one death of a child or staff member after the reopening? Also, how does the county respond when there is an infected student staff member? Will there be a protocol set in place or a quarantine area or facility? Okay, the next is from Jay Piro and doesn't have an address. I'll read the comment anyways. The comment is, there has been much talk about practices that can be implemented in the elementary schools to keep students and staff safe. How are cohorts, outside learning, window openings to allow for air circulation going to apply to upper grades? Some of these schools do not have windows that allow for opening. How are they supposed to have fresh air move around when they will have 120 plus kids in one room a day? Will WIN be discontinued for the year? Okay, next comment from Kristen Cayley at 5216 Clemson. Are there any policies being put in place for testing of teachers before school begins? With the 2-week lag on results with COVID testing, it would be vital for staff to know they were free of passing on COVID-19, especially if asymptomatic. And the final comment from Amy Kientz at 1107 Cottage Lane. For high school students, is it possible to keep them in one class and let the teachers rotate in and out? I would feel safer sending my kids to school this way. Not as much traffic in hallways and contact if in the same room. Maybe extending school hours and shorten the amount of days during the week. And that's it for public comment.
Thank you very much. And again, we appreciate hearing from our community. Take your comments to heart. And I am confident that a number of those questions will be discussed this afternoon or will be looked into in the future. And just to reiterate, I may have misspoken. Our next board meeting, August 17th, 5:30 p.m., will reconvene in the Lincoln Center boardroom as we learn more about the evolution of this disease and as we move toward opening schools. That moves us on to the next agenda item, which is the declaration of an unforeseen emergency. This is what we declared when we first closed schools in the spring, and this is just an extension of that. I'll read through the executive summary and then the suggested action. The executive summary, this action item before us is as follows. Board consideration of current circumstances related to COVID-19 for possible declaration of unforeseen emergency pursuant to 20-9-801 through 20-9-806 MCA, which is the Montana Code Annotated. An unforeseen emergency is defined in law as storm, fire, explosion, community disaster, insurrection, act of God, or other unforeseen destruction or impairment of school district property that affects the health and safety of the trustees, students, or district employees, or the educational functions of the district. With that, the suggested action is motion for the Board of Trustees of the Billings Public School District to declare an unforeseen emergency in accordance with sections 20-9-801 through 20-9-806 MCA due to the community and social health concerns related to COVID-19 and authorize administration to take necessary steps to execute this declaration and inform the public and government agencies of this declaration. Do I have a motion from the board?
Moved.
Motion from Joe Raffiani and a second, please.
I'll second.
A second from Jen Hoffman. Is there any further discussion? Seeing none, I'll do a roll call vote. Joe Raffiani.
Actually, Madam Chair, before we begin the vote, I saw Trustee Hall raise his hand regarding comments before the vote.
Thank you.
Yes, thanks. I couldn't get off mute. So last time we declared an unforeseen emergency, we put it through the end of June. We had to change that date. Is there any concern that that the date may need to change again?
Mr. Weldon, you can speak to that, but at this point, there isn't any date attached to this declaration of an unforeseen emergency. So, Mr. Weldon?
Yeah, I think we would be newsworthy if we could figure out an end date on this. I think it's probably wise to leave the end date open so that we don't have to come back to you every month for this continuing resolution.
Great, thanks.
Thank you, Russ. Are there any other questions or comments?
Madam Chair, I guess we might also, since we periodically review policy, maybe we need to include pandemic in the list of unforeseen emergencies. This
This is as has been outlined in the Title 20 So to add that is going to require legislative action. But maybe you could suggest that to a local legislator for the next legislative session. Any other comments or questions? Mr. Raffiani, anything to add?
Thank you. No, ma'am.
All right. Seeing none, I will call for the question. Mr. Raffiani.
Aye.
Jana Hafer.
Aye.
Michael Leo.
Aye.
Russ Hall.
Aye.
Scott McCullough.
Aye.
Jen Hoffman.
Aye.
Brian Yates.
Aye.
And the chair votes aye. So that brings us on to the next item on our agenda, which is really the meat of our meeting today. And it's a review of the draft guiding document for the reopening of school during this pandemic. And Superintendent Upham has several invited guests that will be also presenting or available for questions. So with that, I'll turn it over to you, Greg.
Thank you, Madam Chair. Before we get into the document itself, I think it's pertinent to have Craig give us a quick update as to the budget that we're dealing with the CARES Act funding, and then the recently released funding from the governor's office. So Craig, do you want to, because it plays a part in what we'll discuss today.
Sure. Thanks, Greg. And I'll work my way backwards. I'll speak to the funds that were most recently announced and on July 17th by the governor. And that's where the total allocations statewide total $75 million. They said about $10 million of that will be set aside for transportation specifically. We're still waiting for some additional guidance on how that's going to work. But of the remaining $65 million, they allocated it based on student enrollment counts for the upcoming school year. And so with that allocation, SD2 between both the elementary and high school districts is eligible for a total allocation of $7.4 million. If we apply by the end of this week, which we're on track to do, we should have money in our account by the end of next week. So we should have the full $7.4 million allotment by next week if we get the application in and approved on time. Another key point is these funds, this $7.4 million, must be spent by December 31st of this year. So that gives us roughly 5 months to get those dollars spent. Any remaining funding left over that is unspent will go back to the state coffers, and we will not be able to access it after December 31st. So that is the latest allocation based on the governor's press conference back on July 17th. Previously, in early April, when the CARES Act was first announced, there was a separate allocation. At that point, it was a $41 million statewide allocation of relief funds, and that was allocated out to schools based on their Title I allocation formula. And so out of that SD2, between our Title I allocation as well as some of our related services allocations, the total came to roughly $3.6 million. And that money needs to be spent by September of 2022, so a much longer time frame than what we just previously discussed on the most recent allocation. Another piece of this is there was a requirement to set aside a portion of our funds for equitable services provided to our non-public school entities within our district. So we worked with each of those entities, received feedback whether or not they wanted to take part and receive some of this funding, and went through that whole process. It really took about 2 months waiting on guidance from the state and reaching out to each of those entities to make sure we had everything we needed. That application was submitted last week, and differently from the allocation that we should be receiving next week of the $7.4 million. This initial allocation, we get the money as we draw it down in the e-grant system. So basically it's different. We don't get it all up front. We get reimbursed as we spend it. So unless there's any other questions on that, that is a brief summary of the two allocations we've received in terms of CARES funding.
Are there any questions from the board? Thank you, Craig. Appreciate the update and look forward to your continued updates. Thank you. Back to you, Greg.
Sure. Thank you, Madam Chair. So the two primary areas that we have earmarked for that funding, Area A is predominantly a safety component built of PP&E, any facility issues that we would need, any additional cleaning products, procedures, any additional FTE, which is considered a full-time employee, so extra staff to clean, disinfect, respond to any disinfecting, any cleaning was Area A. And Area B, and I'm going to ask Ms. Koch and Mr. Russell to talk through some of the procedures and protocols because this will be important. Area B in the identification of that funding is in academic achievement, which would be support in the classroom in any way that we could possibly need. So, Ms. Koch, would you care to share a little bit of the conversation with the classifications of A and B attached to this funding, and Mr. Russell?
Sure. So we had a meeting where we started identifying the needs based on the funding available, and the funding is it has allowable expenses, so it cannot be used to supplement or displace anything from the general fund necessarily to address any of our budget deficits. It had to be, all expenditures need to be COVID related. So we identified, as you talked about, on the safety side, everything that we would need with PPE, cleaning, anything associated with that. And then on the academic side to support the academics. And within that, then we have built in extra FTE for additional supervision in our schools, specifically at the elementary and middle school lunch times. If we can't be utilizing the cafeterias all at the same time and students are needing to eat in the classroom, being able to provide adequate supervision for that while teachers are able to still have their lunch break. We're looking at with the remote learning, if we're needing to hire any additional supports to help support that. Teachers, any type of staff with that remote learning administrator for the year to oversee and build that program. Anything really attached to that, any type of intervention that we may need, technology with the technology supplies access to programs, Chromebooks, ensuring that all of our students who are enrolled in remote learning have an electronic device so they can participate in the online requirements of remote learning, because remote learning is not going to be packets of work sent home. It's going to be synchronous and asynchronous types of instruction that will be done virtually. Mr. Russell, do you have anything else to add?
No, I think you covered everything that we discussed in that meeting, Brenda.
So those are the two primary areas which are overarching for what we're going to need. So the lion's share of the funding is going to go to two areas. It's going to go to the PP&E and safety issues attached to whatever we need when we need it. I have concerns about spending $7 million in 4 or 5 months. That's even saying that out loud seems wrong, but there could be challenges with that. And the challenges with that is we may have some needs on the back end that we didn't know that were happening on the front end. And so, if we could extend that deadline for us, it would be helpful. And I'll carry that message forward with the other AA superintendents and see if we can have any movement with that. The other part of that is FTE. And for our viewers, full-time employees, this is additional staff that we'd be looking at in many areas. It could be in cleaning. It could be in support of academic support. It could be in emotional support. It could be playground support. It could be reading support. It could be in a lot of areas. And as I said at the beginning of summer, we're trying to save as much of that $3 million to go at additional supports for students as they see need, or as we see need for them. So that's where we are with that funding. We gave ourselves a lot of latitude in what we would need moving forward. I'm just a little bit concerned on that tight timeline on the lion's share of that funding source. So, questions on that?
Jana Havier.
Of the 3.6, can you give me a percentage of what has been spent or allocated and what is left?
Sure. Craig, would you like to address that? It's not 3.6. It was 3.2. And for the record, our share that we gave, for lack of a better term, were allocated to support the private entities within our district was roughly 260,000. And so the remaining part is a little bit less than 3 million, correct, Craig, that goes to our district, or maybe a little bit north of that? That's
correct. So there's really two pieces. There's the piece based on Title I allocation, and that's the original 3.2 that Greg just referenced. Of that, roughly 242,000 gets set aside for the non-public schools. And then there's an additional 344,000 that's strictly for related services or idea-based functions that's specific for special ed. So all in, we're receiving roughly 3.6 million, but that'll be deducted by roughly 242,000 for the set aside for those non-publics. And then in terms of the spend so far, so as part of the application process for the initial allocation of that $3.6 million, we worked with those non-publics to get their budgets. We had to combine them into a single budget for us to submit on behalf of the region as a whole. That was, I want to say, roughly $2 million, I want to say off the top of my head, was earmarked for student remediation efforts, and the remainder was earmarked for safety and sanitation and cleaning facilities type work. So that was how that was initially allocated. And then obviously now with the new allocation, that's kind of thrown everything into a different, I guess, conversation, because now we need to find, now the recommendation coming out of the governor's office is you need to spend, this $7.4 million because the deadline is December of this year, and then everything after that should be spent out of the initial $3.6 million allocation. So I guess there isn't an easy answer to the question of how much of that 3.6 million has been spent so far, since we're right now in the act of shuffling how that's going to look with, again, the new guidance we've received on this new money. But as we've been talking about in prior board meetings, when we asked all the buildings and the different administrators to start tracking their COVID expenses, as soon as the shutdown occurred, we tallied that up at the mid-June timeframe, and that was roughly around $200,000. But that was mostly for, equipment, PP&E, some of the machines, the Everclear. I'm not sure what the name of the machine is, but to bring in to sanitize. So it was mostly along the lines of equipment and PP&E equipment. Really now, the student remediation and those types of services, while they've been incurring so far, we feel that the bulk of that effort is in front of us. So I would say the simple answer is of the $10 million total right now that we've been allocated, I'd say roughly so far to date, we've probably spent under $500,000. So most of that is in the future.
Thank you.
I had one question.
Mr. Yates.
Greg, the concern with the latest amount of funding, the 7.4, is the compressed timeline being December 30th and the challenge with that. And do you hear anything from the legislative standpoint, discussion or hope that that there is work being done to look at extending that? I mean, with some of the CARES Act originally, with the Paycheck Protection Program, there were some concerns over the 8-week compressed timeline to spend it, and that was eventually extended. So do you see maybe some possibility, potential, or hope for that to happen with this?
Well, I sincerely use the word hope. The information came to us as of late, either late last week or early this week. We were informed that it did need to be spent by December 30, which we haven't had a chance to even have a conversation. There's a AA superintendent's meeting that starts at 4 today, and I'm sure they'll be discussing. So I have not at this point in time, but plan to.
Okay, thanks.
Any other questions from the board?
Madam Chair.
Yep, go ahead, Mike.
Thank you. I wonder, maybe Craig or Greg, if you could provide a definition of spend. Is that simply costs that we have, incurred or booked before December 31st? And is there an additional period in which we can actually dispense funds that we have indeed spent but have not paid out of pocket for yet?
Yeah. And I can speak to that. There was a question earlier today. We had a statewide conference call with some business officials, and that question came up. It's, at the end of this year, does all that money have to be spent and checks cut and money out the door, or will there be the possibility to encumber some of those funds and make an entry into our accounting system by the end of the year, knowing that even though we maybe hadn't paid that bill yet, that expense was still a valid COVID expense and would apply under the allowances. So that is a question right now, one of many that we've asked for some clarification on, so that we at least are prepared heading into the next 5 months, knowing whether it's definitely a December 31st drop dead date, or if we're going to have a little latitude with being able to adjust around that.
Thanks, Craig. And sorry if I missed this, but would that apply to the hiring of contractors or additional personnel in order to meet requirements of the safety protocols?
So those types of hires and expenses are certainly allowable. The guidance we've been given, and this goes back to kind of what I was saying before, the general direction right now out of the governor's office is spend all the money that out of the initial allocation that needs to be spent by the December 31st first, and then for any expenses that you say would have in the second semester, at that point you would pivot and shift to the initial allocation of the $3 million. So at least that's the way they're telling us, is if you decide to, say, for example, bring on an additional employee, pay for the first half of the year's salary out of the $7.4 million allocation, and pay the second half of the year's salary out of the $3.6 million allocation.
And in the case of a contractor, would it be possible for us to contract and obligate those funds for a year out, say, but we've actually made the commitment within 2020?
Sure. And I think that goes back to that requesting additional guidance on can we encumber those funds for an example like you just gave, or is it December 30th? That's the cutoff, and whether you have a contractor or not, you can only pay them through December 30th out of that pool of money. That is one of those questions that we've asked for additional guidance on, because it's just unclear at this point.
Thanks, Mike. Are there any other comments? Mr. Raffiani.
Thank you. Craig, I may have missed this. I just about once or twice. Do you have, or Greg, can you speak to, do we have some scenarios with some projections, so we have some idea as to, depending on what happens, how we might want to allocate that money, to know, when the time comes, and being able to pivot as you have to plan for as many of the different variables as you can? Are we looking at doing that already with the monies that we think we'll have for the window of opportunity that we think we'll have to spend them?
Yeah, there's two primary areas that have the greatest concern of large spends. And the survey that we sent out on the remote learning answered one of those questions, which I was hoping, but it does create another I wouldn't say problem, but it extends this topic, and that is facial coverings. I was concerned that if we had to provide 17,000 facial coverings per day, 3 million probably wasn't going to be enough. And what the survey revealed to us about face coverings, so that would have been a large dollar item for us. I think Roger was at 91.7% of the homes out of the 8,000 respondents that we received stated that they would be able to provide the face covering. So that's a question you're asking me. Past the PP&E issue, I don't see any large one component dollar item impacting us greatly. The other unknown at this time, and it isn't that big of an unknown, and it's in the FTE. The FTE is where you can expend large sums of money very quickly, which is what I want to do with students who need additional help anyway. So, but the fact is, can we hire that many people, or are they going to be available, right? So with that being said, the one area that is unknown is where we'll land in the staffing between remote and live and how much extra staffing we may need. Now, interestingly enough, when we get further into this conversation, we talk about the number of parents who had expressed interest in requesting remote versus the number of teachers from Ms. Shilriff's survey with the teachers is fairly close, but that also has licensure issues that go with it. So I anticipate that we will be needing additional FTE in a couple of different areas. One, to accommodate both platforms that we're walking out with, and then two, the added, which we fully planned on doing from the very beginning anyway, was adding additional human resource to support our students with their academic achievement or gaps that they'll be experiencing that we know. Now, that being said, what's interesting about that is we fully anticipate extending summer supports into next summer for students that have experienced those gaps, because it's going to take a long period of time to catch people up. So if the virus allows us, I see us moving into the summer. That's why the 7 million short spend is so critical. We need to get to the officials and see if we can extend that, because I see us in that area. So quick recap. One, PP&E, I don't anticipate that it's going to be as large as what we anticipated, because parents are going to provide facial coverings. And then number two is additional FTE needed in areas that we may not know and that we do know.
Thank you. Any other questions for Greg? All right. Thank you, Greg.
Sure. Thank you, Madam Chair. So obviously, as we talk about this, I think it's wise to just recognize that we are in a pandemic, and the challenges that are in front of all of us are huge. I don't think any of us fully understood the impacts of where we are in our country, in our state, in our community, in Billings, SD2. I really don't. But the way I look at it is, it's our turn. It's our turn in this, and it's our turn to find the solutions. And as I said in the board meeting, I'm challenging all of us to look for breakthroughs versus the barriers. The information provided to us on where we are at this time is a wide array of pieces of information. And so this plan took into account many, many, many pieces of information, and our local health officials, local experts that we have, in response to listening to the community and the parents, and we'll continue to our teachers and so on and so forth. It's no easy task at all, and I don't want to minimize that. But at the same time, we need to work to solve this problem, and we will. And I feel confident about that. Are there some fears in front of us? Yes, there are. It wouldn't be right not to mention that. Okay, that being said, let's talk about where we are as far as the science is concerned before we get into this. So I invited Mr. Felton to be with us again, but I asked John to send me, where is our case count today, and where did it start, and where are we? And so I'm going to use case counts from from the end of the month, because we're watching this very closely. We're paying attention to the virus and what it's doing in our community. That's very important. And those conversations are with our health officials, and they're assisting us in guidance with what we're doing. So on March 28th, the weekly count, and John can go over this and explain exactly what this is, but this is 1 week. This is a Sunday to a Saturday, all right? And it's referred to as the MMWR weeks, which is a report from CDC for weekly case counts on a Sunday to Saturday timeframe. So on March 28th, which was the end of the month, not that there aren't other weeks, but I just use the end of the month because it's a good comparison to be able to kind of see where we are at this point in time. I want us to pay attention to the science and put it in the forefront and address it from that perspective and not address it from a perspective of fear, even though fear is real. On March 28th, our case count for that week was 15. This is Yellowstone County. On April 25th, which was the last week of April, so I gave you the last week of March, on April 25th, which is my birthday, thank you, was 8. We were at 8 for that week. The end of May, we were at 13. Number 13 on the week of May 30th. On June 27th, which was the end of June, the case count was at 33. And on 7/25, July 25th, the case count was at 173. Okay, it's been referenced in some of the information that we're sharing. So in my conversations with Mr. Felton, I said, John, are we at a point with the increase in the cases where we would consider not offering school? And his response was no. And so, John, would you please take us through the case counts and some of the rationale for where we are with that at this point in time?
Sure. Thanks, everybody, for inviting me back. So we clearly have seen a significant uptick in cases in Yellowstone County and throughout the state. Part of the reason that the percentage increases have been very significant is for a very substantial period of time, our case counts were really, really low. Where as a state, there are many days where we had, particularly through May, April and May, where we were down, 0, 1, 2, 3, 4 cases a day statewide. And obviously those numbers have changed dramatically. The increases started about mid-June, which we've actually prognosticated because phase 2 started on June 1. We made it through phase 1 with very little increase. There was a slight increase, but very, very little increase in cases through phase 1. The keys to phase 2 were an expansion of the occupancy loads in things like bars and restaurants. All types of businesses essentially were open, including places of assembly, and the interstate travel quarantine, where people coming into Montana from out of state, whether residents or not, and had to quarantine for 14 days, that went away. So we anticipated we'd start to see increased case counts. And that has indeed happened. I want to talk a little bit about where those cases are coming from. We are going forward, we'll have even better information because we've revised how we're doing our contact investigations and case investigations. Many of those large increases have come from a couple different sources. One is households and families. So that's things like barbecues, weddings, birthday parties, things like that, where people in a family or close friends come together and they feel comfortable getting, much closer and not masking, and we see a number of cases coming from that. We've seen a significant number of cases coming from workplaces. We're not seeing a huge number where it appears as though a customer infected a worker or a worker infected a customer. It's much more workers infecting workers. Social events have been we haven't seen a huge amount from large events, but again, much more in the smaller events. So people who go out together and have a night at a bar, or people who have their family or neighborhood events. I think the other place that really has had a significant impact in our community are the senior living sites. I think for the last, I'm not sure what the total number is now, it's 8 or 9 days, maybe 10 days, we've announced a death in Yellowstone County every day. Most of those, not all, but most of those have been related to older folks in long-term care facilities, and particularly the well-chronicled and tragic Canyon Creek Memory Care Facility. We have very close to 100 cases just from Canyon Creek. About 56 of those, I think, are residents, and about there's somewhere north of 40 are staff. So that is a pretty significant bolus of cases that are really very clearly linked, and it shows. So part of what we're seeing is comfort with not worrying about physical distancing, and comfort with not worrying about facial coverings. There are some data that we need to look at and put in context. One of the important things is we are clearly doing a lot of testing. We are not seeing a large number of cases where people who are asymptomatic and chose to be tested came back positive. That number is not zero. From our Metro testing event on July 11th, we just started getting results back yesterday of asymptomatic people, and we had 8 who came in as asymptomatic and were positive. To put that in context, we tested something like 680 people who were asymptomatic. Not all those results are back. I'm not sure what the end of returned results is. But most of the cases that we're seeing are people who are symptomatic. So either they were symptomatic and they went and got tested, or they were a close contact and went and got tested. But according to the Becker Hospital report, which is kind of keeps an eye on things, Montana's positivity rate has been 3.7%. That puts us in the bottom. If you divide us into fifths, we're in the bottom fifth. We're about 40th out of 50. At the high end of that, Mississippi's running at 23% positivity. Arizona's at 21% positivity. Florida's at 19%, and we're a shade under 4%. And that does include, we have generally a higher proportion of people who are tested. There is some difficulty in interpreting the test results in terms of the rates of positivity, because, again, well-chronicled concerns on how long it takes to get test results back. That depends to some extent on, are they symptomatic people, are they known contacts, or are they asymptomatic? But for instance, on, I think it was Sunday, there was over 6,000 tests reported that's coming back positive. So clearly a large group of those had to have been some asymptomatic people coming back from Quest Labs and National Jewish in Denver. So it's I think we have to be really, really careful not to say, well, we got 1,000 tests back and X number were positive, because those 1,000 tests could be from anywhere from 24 hours to 4 weeks old. But overall, we still have among the country's lowest rates of positivity. We have a very low rate of hospitalization. Less than 6% of all of our cases have been hospitalized. I did notice there was one comment, so I looked this up really quickly. There was a comment that Mr. Van Nuys read that I believe said something to the effect of a large proportion of people who are sick are children. In Montana, of confirmed cases, 6% are under 19 years of age. So it is not zero, obviously, but it isn't a large proportion. The largest group we're seeing right now are 20 to 39-year-olds who are getting ill, and that's largely because they're going out socializing and doing those kinds of things. And then the other piece that plays into this is what is our mortality rate. And our mortality rate is about 1.5%. Of the 54 people who have died, about 15 of those are from Canyon Creek alone. 54 in the state, 15 are from Canyon Creek. So as we worked with school district leadership on how to put this plan together, I think there's a couple things that come to the fore. One is there is lots and lots of resource material out there. We used information from the CDC, from the American Academy of Pediatrics, from the state OPI, from the governor's plan. They all, to some extent, sort of say the same thing, but they also have some nuanced differences. I think from my perspective, it was interesting in listening to a lot of the comments. I think what people are really hoping for is a plan that eliminates risk to teachers and staff, eliminates risk to students, eliminates liability risk in case someone gets sick. I just have to say, and I've told you all this before, I do not believe there is a risk-free option. There are different risks that we can engender. Obviously, the more people who are compressed for extended periods of time, the more risk of spread of disease. There's lots of social and psychosocial issues that are clearly related to not having children in school. One of the big things that we talked about, and Dr. Koo from Billings Clinic was involved in these conversations with me and the leadership of the district, is as we bring kids back to school, particularly in middle school and high school, where they do move around from class to class, the highest likelihood of compression is going to be in the passing periods when kids move from first period to second period. Those are very brief interactions. So if you have a 5-minute passing period, even if two kids were together for that entire 5 minutes, they would not meet the definition of a close contact should one of them be ill. A close contact in COVID-19 is 15 minutes or more consecutively for 6 minutes within 6 feet or less. 6 feet or less, 15 minutes or more. It takes both of those to be a close contact. So in a passing period, indeed, yes, students will be compressed, but they would not be considered a close contact should one of them become ill. So that's part we talked a lot about how you decompress places like lunchrooms, classrooms, playgrounds. One of the questions again that came up in the public comment was taking temperatures. We did talk about that with Dr. Koo and me and the superintendent and the executive directors. And in that conversation, what comes clear is, first of all, about a third of people who become ill and are diagnosed with COVID-19 do not have fever. So it is not an absolute fail-safe. The other issue is, quite frankly, there's probably more risk of compressing kids while they're waiting to get in to get their temperature taken while they're standing in line than there is risk of them going to class and having their assessment done without taking temperatures. One of the things that is commonly used is what's called subjective fever. We all know what it feels like to be feverish, and so you just ask, have you felt feverish? So I don't want to get in. I'm going to leave it to the superintendent to go through the details of the plan. I think what I would like to say to you all is there is not a risk-free option. We are going to create some degree of risk unless, if we want to completely eliminate the risk of disease transmission, we need to have everyone go in their house and stay there for a couple of months. That's clearly not going to happen. If we want to completely eliminate the risk of psychosocial, economic, and social connectedness risk, we need to let people do whatever they want to do and spend all the time together they want to spend and however big a group they want to spend. We're going to end up somewhere in the middle of those two extremes. One of the things I think we really focused on in our organization is we have to somehow come to peace with the idea of we're going to manage risk and mitigate risk. We're not going to eliminate it. So with that, I will turn it back.
Mr. Felton, this is Greta. In your definition of close contact, you said 15 minutes within 6 feet of contact. Is that inside, outside, with mask, without mask?
So the CDC does not differentiate those things. Clearly, there is less risk of transmission if people are masked, particularly the ill person, because they're reducing the expression of droplets. The CDC simply says 15 minutes or more continuously within 6 feet or less. Now, again, we have to talk about mitigating risk. We mitigate risk with masking. We mitigate risk to some extent outdoors. It's better to be outdoors, but it doesn't make it go away. So that we just use that single definition to define a close contact. The other piece of this that's really important is there's a time frame involved. So we don't begin to ask people about who they were in that close contact with until we get to 48 hours or 2 days before symptoms began. And I think this has been really one of the big heartaches and upsets that people have had. We have responded to something north of 4,000 calls in our organization since this began, not including all the emails and other forms of contact. And I think there's a lot of people who get concerned that, well, someone was found positive and I'm a contact. Well, first of all, you need to meet that definition, and it needs to be within the infectious period, which is 48 hours before symptoms began. So I know there's a lot of concern about, if someone comes to school, is the whole school infected? And a close contact answer, that's no. What if they came to school on their last day in school is on Friday and they develop symptoms on Monday? We wouldn't be concerned about that. So it's a much more nuanced analysis than simply there was someone in the school who was diagnosed, and that's where that whole case investigation and contact tracing piece comes in.
And as a follow-up, you also talked about the low incidence that we have in the state of Montana. Have you done a comparative analysis with other states that are the same size as our county or the same size as Billings?
Yeah, we tend to look around our region. We still have a significantly lower prevalence rate than the region. I did some analysis probably a month ago looking at the largest city in North Dakota, South Dakota, Wyoming, and Idaho, which is very similar to our situation, where there's a lot of rural space and typically one pretty significant city. And in those cases, our incidence, our prevalence rate is still substantially lower. There is no doubt, and I don't want to understate that we have definitely seen a significant increase in cases since the 1st of July. We have more cases in July. Actually, we had more cases by the middle of July than we had in the previous 3.5 months in Yellowstone County. So there's definitely an uptick. We're not in the same situation as what you're hearing in places like Florida and Arizona and Texas, where hospitals are full, ICUs are full, large numbers of patients on ventilators. Our count today, just to give you all an update, this was as of about 1 o'clock. We had 42 inpatients in our 2 hospitals, which is about 2/3 or a little more of all the hospitalized patients in Montana. Not all of those are Yellowstone County residents because we have a regional medical presence. And of those, 9 were in the intensive care unit and none were on ventilators. So yes, we definitely have seen an increase. COVID itself has not stressed our hospital systems. However, our hospitals are quite full of other patients. And so we're in what we call yellow status now for hospitals because they're full of a lot of people.
Thank you. Questions from the board? Mike Leo, are you raising your hand?
That was Russ Hall, but I'll take his question time. Mr. Felton, what's the latest research on positivity and transmission for children, say 12 and under?
So it still appears that a significantly smaller proportion of young children become ill. They also tend to have much more mild disease. Now, again, we're talking about large numbers, so that is not to say that no young children become ill and no young children get very ill. But as a population, they tend not to get ill. They get ill at a much lower rate, and they tend to have much milder illness.
Thank you. And I was wondering, given the dearth of testing results, would it make sense for the district to hire contact tracers and or contract for testing or buy testing, if that's even possible, in order to monitor our population at least? And if so, would that be helpful to the county health officials?
So in terms of testing, we get pretty good timely testing on symptomatic and known contacts. Those are typically back within 1 to 3 days, sometimes 4, but especially for symptomatic people, those get tested in Helena. They don't get sent out. Where we have testing issues is on testing asymptomatic populations, the so-called surveillance testing. I will tell you that Riverstone Health has ordered 5 rapid testing machines. Those are 3 to 4 months out to get them here. So there's a big backup. There's issues with reagents that we're hoping by the time we get our machines that those will be resolved as well. In terms of case investigation and contact tracing, we have substantially increased our resource base. We've hired a couple dozen people to do contact tracing. We've got 21 student nurses who are doing that on a part-time basis for us through the Montana Department of Emergency Services. So we are up to date. We did fall a little bit behind last week. We caught up and we've been able to keep up. So today we're doing all the investigations and contact tracing on cases that were identified yesterday. I think we have to be careful when we start having sort of private contact tracers, largely because you won't necessarily have access to the information of who's positive, because that's not going to go to you as the employer or as the school. It's going to go to the local public health agency. We, by law, cannot share that information. So unless we hired your people to do this, and at this point we're managing that. So I think when we have access to sufficient rapid testing resources, machines, and reagents, that will actually solve a lot of the issues we have. The rapid testing platforms are much more reliable than they were initially. They're just not available. So we really need to be at a point that when people need to be tested, we can bring them in, test them, and within an hour tell them you're positive or you're negative. And so even if you order those machines today, you're going to be, again, mid-school year before those come online.
Right. Thank you. And I just wanted to put out there, much in the same way that we cooperate with the police department to have, safety personnel in the schools. I would encourage us to look at a similar situation where we can, spend some of this money to hire and contract folks through you and under your auspices in order to serve this large population that's about to come together. Again, if you think that would be beneficial.
Thank you.
Thanks, Mike. Russ, did you have another question?
Yeah, and thanks, Mr. Felton, again, for being on our meeting so often. I've been following, since the outbreak, following the Johns Hopkins University reporting, pulling it together, and just looking now at a county by county, look. So they have Yellowstone County, and then looking at some hot spots, in Arizona and Los Angeles, New York. instead of percentages, it seems like the most accurate view is the number of cases per 100,000 people, because that's an apples to apples comparison. And currently, according to, to this report, we're at 568 per 100,000, which is significantly less than some of these other hotspots. At what point do you, and by extension us, start getting concerned about the number of cases? Because clearly that's the biggest concern that parents have and that teachers have and that we have is, that this might blow up here in Yellowstone County. So at what point do we get concerned, and how do we kind of, if that were to happen, how do we resolve that, especially when it comes to schools being open?
So we have, through the Unified Health Command, we have a medical technical team that is made up of physicians and public health nurses and infection prevention and control nurses. And they are actually the ones who follow the data for us. And for us, it's a bit more broad than a single measure. We are following, obviously, cases. We're following, when we were doubling cases every week, that becomes a concern because you're talking about exponential growth in cases. That happened for a couple of weeks, then came back down. The other piece of that we have to pay attention to is the burden on our hospital systems, and also then, in our particular case, we're very concerned about the regional situation. So as I said, not all of those 42 patients who are in our hospitals are Yellowstone County residents. Yellowstone County's medical services actually service a population of about 650,000 people over 4 states. And so all of those pieces together come to us to determine what comes next. And so we're trying to be much more surgical in our interventions. So for instance, when we started seeing a number of cases at long-term care facilities, I instituted a health officer order that locked down visitation, except for end-of-life compassionate care. That's much better, I believe, than just sort of a big, reinstate phase 1, because our issue wasn't at businesses. I think one of the things that's going to be really difficult with respect to the schools is, although I think a lot of people would like this, we can't treat school as a light switch, right? We can't turn it on. We can't turn it on now and turn it off because we get a burst in cases, and then turn it back on a week later, and then turn it back off because, the hospitals get full. I think that's going to be a real challenge. And that's part of that risk management that we've got to gain some degree of comfort with is how are we, I will just virtually, I'll come close to guaranteeing, and I don't guarantee much, that as time goes by, we will have additional spurts of cases. Something will happen and we'll spin up. Some people are concerned about the fair. Some people are concerned about school. Some people are concerned about swimming pools. Some people are, it kind of depends on what an individual is worried about. There will be bursts of cases. To the extent that those are tied to something that we can identify, so an event, a party, whatever, that's different than if we just had this steady increase in community spread cases. So it's a really kind of nuanced analysis that doesn't have what I think all of us would like, which is what is the switch? What tells us it's time to do something? Fortunately, we've got a really strong medical community. We've got really strong public health and infection prevention nurses involved that are helping us do that analysis.
Thanks, John. Did any other trustee have a follow-up question or additional questions?
Madam Chair.
Joe Raffiani.
Thank you. Mr. Feldman, as always, appreciate you being here and your efforts in all of this. And so first and foremost, I wanted to try to kind of quantify those efforts vis-a-vis our reopening plan. Have you been reviewing the drafts? Have they been produced and mapping those changes and those sorts of things? Have you been not just participating in the creation of them, but have you actually read it?
Yes.
Fantastic. And so is there anything in there that you think is wrong, off base, needs to be corrected, the community needs to be warned that the sky is falling, that we're missing something?
No, I don't. I think the community needs to understand I realize this is sort of a difficult concept for some, is this plan, as well as every other plan we've got, whether it's the governor's masking order or the phased reopening or any of those, are a matter of we're trying to mitigate risk. Eliminating risk is not in the cards. We've got an infectious disease. The disease that's spreading in our community, in our region, appears to be one that is more transmissible now, but is not causing as bad a disease as some others. So, if the question is, do I think that this plan solves every question? No plan will. But I've been through it. I've read it. I've been involved with medical folks in reviewing it. And I think it's a reasonable approach to try and get kids back to school, mitigate the disease risk as well as the other risks we talked about, the social, the psychosocial, those sorts of risks that are out there.
All right, and forgive me, in case you don't know, I'm a lawyer, which means I have to move in very small increments of information, and I will kind of act dumb because I am dumb about this. So with regard to things like the positivity rate, you were able to talk about the positivity rate for Montana, and that is still below 4%. And I'm unaware, if I was good at math, I wouldn't have become a lawyer. How does that work in terms of if we don't have robust testing of asymptomatic people who might be testing positive but don't show symptoms and so don't qualify for the 1 to 3 day testing result return, are we potentially underreporting the positivity rate or undercalculating, not underreporting? I know my choice of words is also really important to. Sorry, I'm looking to the side because you're on the side of my screen. So, am I making a question that you can respond to yet?
We're sort of getting there. I think we have to talk about, in the best of all possible worlds, we'd have virtually unlimited testing and very quick results. We don't have that. We're moving closer to that as we get more rapid testing resources available. I think where we can draw some comfort, let me just go back. Your original question, is it possible that there are people who are asymptomatic and infected that we've missed? Absolutely. In fact, I'd say we can blow past possible well into probable. What we do know is that when we have tested asymptomatic people, the positivity rate is extremely low. So in our first testing event at the end of June, which we did get all the results back on, out of 463 people who were tested, and that was by definition a asymptomatic testing event, there were 3 positives. When those were followed up with, all 3 of them admitted that they had symptoms when they came, but they wanted to get tested, and so they said they were asymptomatic. Now we're sort of seeing the flip side, where people want to get tested, and if they don't have symptoms, they say, well, yeah, I've got a runny nose. So it's not perfect. When you look at all the testing that's been done, there's a 96% likelihood that those tests are negative. So, it's higher than that for asymptomatic people. It's lower than that for symptomatic people.
And so with the best information available to you today, you can't say that Yellowstone County's positivity rate is any different than what the state's currently reporting?
Right. Yeah. We've got some data that our medical technical team uses that's a little more local. Yeah, it's some of it has to be inferred. Some of it has to be kind of figured out from totals. I do think that the testing issue is made really difficult in terms of current positivity by the fact that when we get test results back today, there's going to be some of them that are yesterday's tests and some of them are going to be a month ago tests. And we're really struggling with that, and the state is struggling with that.
Okay. And then for some perspective, I'm hoping that you've been in communication with maybe 1 or 2 other health officers around the state of Montana, sometime since March.
Pretty good.
Yeah.
Many times, several times today.
And so in those communications, those people have also been participating, presumably with their school districts, school boards, to work on their school reopening plans as well. Even though I'm not on Facebook, I still hear a lot about Bozeman and Missoula and how they've developed either phased plans, or they have plans for hybrids starting this fall, maybe moving into all in person, but not starting there. And so if the positivity rates and all other factors, I mean, what are the factors that aren't equal that would make those the more safe plans that their health officers are saying, yes, I've reviewed this plan and this is the best way to thread the needle, but our district is coming up with a different option?
Yeah, I think all of us as health officers look to the school districts as the education experts. What we understand is that there's some issues that are associated with kids not being in school, and there's some issues associated with kids being in school. We can look at the public health implications of those and help advise as to, do those plans mitigate risk or not. In terms of the academic programs, that gets into a lot of issues of the staffing of the schools, the resources of the districts. That is not our area of expertise. So when Dr. Koo and I helped with looking through these plans, our main emphasis is, does it help mitigate risk? And yes, it does. I think there's a lot of factors, socially, economically, psychosocially, academically, resource-based, that vary from community to community. And so I think it's not surprising we get some different plans coming out that different communities are going towards. None of them are going to eliminate risk, and none of them are going to be the perfect plan. There's an old saying, goes back to a Prussian general of the late 19th century, who said that no battle plan survives the first encounter with the enemy. I think there's a good possibility that no matter what plan is selected, it's going to change over time. I would be cautious, though. Let's not pretend that means that it's a light switch. I think it's really critical to say we can't tell families, okay, school's in session. Oops, we had to rush a case of school's out of session. Oh, wait a minute, no, we're back. So I just think that's the kind of certainty I think people want. That's just not, I don't believe is possible.
Mr. Felton, I want to thank you for being on this call. Your wealth of knowledge, your calm demeanor, clinical analysis. With this, I'd like to turn it back over to Superintendent Upham so that we can have further information on the plan going forward. With Greg, I'll turn that back over to you.
Sure. Thank you, Madam. Thank you, Madam Chair. I appreciate that. And thank you, Mr. Felton, for your support and information, and also Dr. Koo and the pediatricians that we work with, and our school nurses, and just a plethora of individuals. I think the best place to start is right with the instructional models, because that's the day-to-day situations that we'll be facing. And so what we're proposing, what I'm proposing in the reopening plan is two educational platforms. One is remote and one is live. So let's talk about the rationale. So initially the rationale for the remote was going to be smaller, because at the time that it was initially designed on the remote side, was the cases were much lower and there was much less concern, fear in the community, rightfully so. As the cases began to grow, and as I shared with you, as we looked in July, the request for remote learning rose significantly. And that being said, that prompted the survey, and then also a redesign, if you will, or not so much a redesign, but an expansion of that remote learning. Initially, it started out in my conversations with the community and with individuals, was trying to hold to what the research was showing and what we knew. And that was that live instruction, face-to-face instruction, was the best that we could do. And in looking at the informational documents that have been that we used in our reference, as we used in references for this document, in the Academy of American Pediatrics, they state significantly, very clearly, and so do our pediatricians locally, that students need to be back in school. Okay. We also know that we have students, and we have students' families, and we have staff, and we have staff families that have COVID-related issues, some quite significant. So initially, in the remote side, my initial conversation was that students who qualified and or families who qualified for COVID-related issues as documented by IDEA or 504 accommodations or unique circumstances. Why was it restrictive? Well, one, the challenge in a district our size, and I think it's important just to state this, that we are different. We are much larger. There are many moving parts to us. It's not an excuse, it's just larger. We're larger, almost twice the size of Great Falls and Missoula. Not quite, but we are very large. So there are other issues that we have to deal with size like this. In seeing the growth in the virus and seeing the number of cases grow, then we switched and we said, okay, because we're getting more requests and because it's more prevalent, and because we can maybe affect the number of enrollments in live instruction, let's open up the remote instruction. Now, the remote instruction, here we go with the trade-offs. So the remote instruction we found last spring didn't work real well for a large majority of students. It just didn't. That wasn't because a lack of effort by teachers. It wasn't from a lack of effort by families. It just was extremely difficult. We had a small percentage of students that did very well. But the numbers that I've used, and they're not scientific, they're approximations, but approximately 70% of the students involved in remote learning last year, when we were marched through the end of school, pretty much held their own. And holding their own is not good because we grow. And then roughly 30% were significantly disengaged. Okay, so if we can, if the virus allows us, we should put as many students as we can in live instruction. That's on the academic side. On the social emotional side, as listed in the documents by our health professionals and by the Academy of Pediatrics, they are concerned about the lack of reporting of abuse, neglect, hunger. They're concerned about morbidity rates and mortality rates. So from a public health perspective, and Mr. Felton has added this too, they are concerned. They are concerned that our in Yellowstone County that our child abuse cases are down 41% from what they normally are. So that doesn't mean that they're dropping. It just means that they're not being reported because the students aren't in school. Okay, so that's a puzzle piece for us. Now, in knowing that the virus is increasing and getting closer to school and having people realize that school is, going to start and that it's closer, we saw an increase in requests and also an increase from our faculty in concerns whether they are directly impacted with their own health or whether there's someone in their family that's impacted by it. And these stories are real. They're absolutely real. So the thought behind opening the remote learning up as wide as we can possibly get it would help two things. One, it would help families who are struggling with COVID-related issues, anxiety, fear, and it also assists us with helping our faculty move to a remote setting that are dealing with COVID-related issues, health issues, and that type of stuff, and also at the same time, reducing enrollment in live instruction. When we talk about hybrid models, the rationale for a hybrid model would be to reduce enrollment. And the best model that I saw, and we worked through as an executive team, was it's referred to as the AACBB model, which would do this. You would split your students in half by household, not so much by alphabet, because we have students that are living in the households that may have different alphabets. because you don't want one student going to school one day and the other day. It has challenges to it. The challenges are, one, that it can be extremely disruptive to parents who need the schools as childcare, the working parents. It would also impact our staff of their children because they would be teaching when their own children are home. There are issues with it. Are they incomprehensible? No, but there are significant challenges with it. It's also a situation where it can compromise the instruction, and I'm not saying that the instruction is more than the safety of individuals. Also, in the pediatrician piece that I read is that lower, let me read this to you, lower student to teacher ratios, and this is from our local pediatricians and what they shared with their document in advising us, do not have significant impact of transmission of COVID-19 according to current evidence. The overarching component that I shared in the Face the State is that we know that students are mixing before school and after school. Okay, so what we're trying to do with the remote and live instruction is create its own hybrid, if you will. There have been questions from families that ask, if my student is in a remote setting and their personal condition allows for, i.e. health, to take an advanced class that may not be offered through the remote, can they do that? And we said yes, absolutely. As long as there is enrollment availability. That's part of the challenge for us moving forward will be as we're building these two platforms, is to see exactly how many students are going to request what, because then we'll staff it appropriately. I'm not concerned about it. It's just a matter of seeing if that's the case. So another case could be that if I'm a student who's in remote learning and I want the advanced band class, we're going to say yes. They may not be able to get that. If I'm a student that's involved in remote learning and I want access to activities, am I going to be allowed access to activities? The answer is yes. Again, everything's a trade-off in this. We've had extensive conversations as executive teams with our building administrators and walking through this, and I'll have conversations with our teachers, and I've visited with a small group of teachers and other teachers in this, but it'll become larger as this draft plan becomes available to all. In fact, I sent it to all of our staff today earlier. And so when you weigh all that out, the hope really in the two platforms is that the remote will take roughly 30% of our student body, and it looks fairly even across all grade levels. So K5, 6, 8, 9, 12. The respondents in that is a little over 8,000, and it showed a 31% interest in taking remote learning versus live learning. So the hybrid creates some challenges, as I explained to you, and can go deeper into that. I think with the facial, at least I feel, with the facial coverings, the remote learning, the ability to reduce the enrollments and the live instruction and still offer the quality of the live instruction that we know we can, overall is in the betterment holistically of all. And I asked that question and ran the scenario by Mr. Felton and Dr. Koo and talked through all of this because it's all risk versus reward. And so they agreed. Now, could things change? Possibly. So we do know that there's flexibility in all of this. So what I'd like to do is introduce Becky Carlson, who is the administrator that's going to oversee the remote, because there are a lot of questions with the remote side. And what we are going to try to do with the remote side is offer as many options as we possibly can. We can't do everything for everyone, but we surely can expand. And Mr. Russell secured Apex Learning, which is an online, which we use in our summer school and our frameworks. It's new to us, but we did some work last year. It gives us a lot of flexibility as far as online curriculum in conjunction with our own curriculum moving forward. So Becky, do you want to introduce yourself and maybe talk a little bit about where we are with the remote learning?
Yep. Thank you for having me today. I am Becky Carlson. Just to give you a little background on me, I had the opportunity to teach at Blue Creek for 10 years. I have a background in curriculum, working for a consortium that was located here in Billings, but serviced schools around our community, and have been an associate principal for the last 2 years. So thank you for giving me the opportunity to take this on. Just a couple things that I've been working on. I started Monday looking at what we need to do as a district in order to get this rolling. I have created a enrollment form for requests as far as whether or not you want to take remote instruction or if you want to be online in the classroom. And with that will help us determine staffing and also which families, which students will be choosing which platform. From there, we are looking at, in that request form, what are some expectations with the remote learning. And Ms. Koch did a really good job of kind of laying out some simple talking points on that. One thing being that the child needs to adhere to student code of conduct, that they need to promote active engagement in the learning process, and it needs to be a parent-family commitment with the kids, because the teachers and the families are going to be working together to make sure that this rolls out successfully for the students. That students need to participate daily in their coursework, sustain good attendance. There needs to be a platform of synchronous and asynchronous learning activities. And when I use those terms, synchronous and asynchronous, synchronous means we are giving live instruction to students, and that can look different. It can look a whole group type of setting where they're having online live session. It can be anywhere from individual sessions that are arranged by the teacher and the student, or it could be group settings. So when we talk about synchronous, it's giving that direct instruction to the kids that they would be receiving if they were in an actual classroom in a building. Now, when I speak about asynchronous, this could look different. It could be there's projects that kids are creating and they're having to work in group settings through the online platform, or it could even be there's assignments that teachers provide and that they prepare and post onto Google Classroom or Seesaw, and the students then have to work through those assignments on their own. So those are just kind of those are the difference between synchronous and asynchronous. The other thing too is that they need to make sure it is important that in this remote learning model, they must be engaged with the assignments, the video lessons, digital tools, the software, other learning tools that we will provide for our students. They need to be actively engaged on a regular scheduled school day. Right now, we don't really have a plan as far as what that regular scheduled school day is going to look like. I've spent a lot of time researching, meeting with a past friend of mine who actually did build a remote learning plan for a district, and just trying to kind of put pieces together. So that doesn't look quite final yet, but we will weigh out what's going to be the best option for our students, for our staff, and for our families. And I'm trying to think, what else, Greg, have I been working on? Oh, the registration will be through the parent portal, through Power School. So families, when we make that go live, when it's pretty close to being finished, when that goes live, it will be Friday, and they will have to go into the parent portal, and under forms, which would be on the left-hand side, they would select that, and then they would click the 2020-2021 remote learning request. And like I said, we would like for parents who are choosing that in-building option to also fill it out. That way we have an accurate number of who's going to be in which platform. I'm trying to think, anything else that you can think of, Greg?
No, I think you're covering it. One of the questions before I kind of open up the remote side for questions, one of the areas that has created some angst with families is the 1-year commitment. Some districts, as we know, and trust me, all the AA superintendents have been discussing all of their reopening plans and rollout plans. And so we've looked at them all, and we've had active conversations from the very beginning. Is the 1-year commitment. So Great Falls said they can do it in a semester, and okay. The reality for us is if 30+% of our students and families choose to go remote, which is what the survey said, I sound like a game show host, what the survey said, then that's roughly 5,000 plus students, K-12, that will be requesting remote learning. That's a significant staffing issue. That's over 200 FTE teachers alone that could or will be impacted by that. Now, that's not a bad thing. That's actually a good thing, because in Ms. Shilriff's survey to her teachers, our teachers, roughly 21+% requested to have remote type opportunities. That helps us. And so in areas where licensure fits and health issues are looked at, then what we're trying to do with both platforms, the remote platform and the live platform, is to create win-win. Now, that being said, the teacher's licensure, professional's licensure has to match the need. And then we have to ensure through training and such that we have quality education. And I'm not concerned about that. I'm very pleased and proud of our staff. So I see that as a win-win, which again, back to the original part of this conversation, the rationale initially was to keep a pretty tight rein around remote learning. And the question was why? Well, we knew from last spring that direct instruction had the most benefit for students. So we wanted the majority of them in live instruction. As the virus increased and people became more and more concerned and health issues became more prevalent, then we saw the need to expand the remote learning model, which is what we've done. And in doing so, to create safer environments for children, families, and staff that will benefit from the remote. So the year-long commitment, and I think we need to be honest with ourselves in this, to change that much staffing in a district this size is monumental. Okay, can it be done? At mid-year? Probably. Would we look at it? I will definitely take a look at it. I learned a lot from the graduations, I'll tell you. Do I want to promise that will occur? No, I don't. And the other reality that we all have to understand, and whether we believe this or not, is the virus going to be gone in December? Is it going to be that different on January 18th or so when our semester is over? I don't think it will be. I think the virus is going to be here, and we're going to have to deal with it until next summer, and then possibly after that. So is there a hard line on a year's commitment to this? I would say yes. Are we and will we look at it if we need to? Yes. Can students go back and forth? Unknown, because it's based on enrollment availability, other than we want to allow students in unique circumstances that can't get a course online that they need for specialty or for specialty interest to be able to do that. It's not their fault that the COVID is here. Should I not be able to play volleyball because I'm in a remote setting? No, I don't believe so. We're trying to be as flexible as we can with this. But it does present some significant issues to dismantle an operation this size mid-year. So that's the rationale and thinking behind that. So in quick summary, the two instructional models that we know we can do well is remote and live. And hopefully I answered the questions about hybrid. I'm not down on hybrids. It just presents significant issues. And I believe with the remote and the number of students participating in it in conjunction with the live, that we can create win-wins. So I'll stop there on that piece.
Questions for Greg on remote versus in live instruction? And Jana Hafer, I recognize you wanting to ask a question.
Thank you. Thank you, Becky and Greg, for that information. I appreciate your statement that it is difficult in a district our size to make a one-year commitment, but that is best, with the caveat that you will at least look at it if need be. My question is, when do you want this enrollment form filled out and back to the district?
The enrollment form will be available Friday. I have not placed a deadline. I placed an informal deadline of August 14th, but I'm hesitant about that. I need families, we need families to sign up as soon as possible. They fill the survey out so that we can move forward. We're ready to go. And so I will send that information out in my newsletter. I'll also send that information out via the Facebook Live. I'll send it out to all staff, but we need families to acknowledge as soon as it comes up on Friday to enroll as quickly as possible.
Thank you.
Greg, you've used robocalls in the past. Is this would that be a vehicle to contact parents about this application form?
Absolutely.
Other questions for Superintendent Upham? Mr. McCullough.
Thank you. Maybe this is a question more to you, Madam Chair. Are we at any point as a board going to endorse the opening plan with an official vote, or are we just going to be monitoring it as we go? I'm not sure what direction you'd like to go is where I'm at.
You know what? Instruction typically falls underneath administration, as you know. Mr. Weldon, do you have a comment on that?
No, I actually agree with that. I looked at what your policies provide with the superintendent and the superintendent's authority. And in this district, most districts, the board doesn't get involved in that level of instructional program. Of course, these are extraordinary circumstances, so the superintendent's going through the detail, going through the program in some detail. There may be things that the board will need to look at in the future, but I think at this point it falls well within the superintendent's authority to design how the school year opens.
Thanks, Jeff. Is there any follow-up?
No, thank you very much. I was just curious where we were going.
Thanks, Scott. Any other questions at this time for Superintendent Upham? I see two hands, Jen Hoffman, and then followed by Joe. So Jen, you've got the floor.
Okay. I just want to make sure I'm understanding this correctly, that you will have separate teachers teaching online, separate teachers teaching live. They will not be the same teacher doing both. Is that correct?
That is correct, Trustee Hoffman. The feedback from our certified staff, teachers specifically, strongly requested that they not be put in a position to teach a dual platform within the same class or course. As what they saw was that students who were learning by packet and students who were learning online in the same class presented a significant challenge for them to do the quality instruction that they're used to. And so I'm honoring that with that request to go standalone, remote, standalone live.
Thank you.
Thanks, Jen. Joe?
Greg, I was curious. It seems like we did a good job in terms of our hoping for the best and planning for as many worst contingencies as we can with marrying the remote learning student population with the remote teaching population. And I'm assuming we're kind of just waiting until August 14th and thereafter to see how well those gears are meshing up. Is that a fair statement?
Yeah, and that's why I have some consternation about the 14th. I'm just speaking honestly with you. I want to be able to give families that time, but at the same time, it puts us in a strain. Now, that being said, I'm not on the remote side. I am completely comfortable and have given permission to Becky and the team of individuals that are building the remote platform to do a slow roll-in. We need to go slow before we can go fast with this, because we want quality. This will be different than it was last year. Not that people weren't trying hard, but there will be a lot more parameters around the remote learning than we had last year, and we want to control those variables. So when I say a slow roll opening, we want to ensure, number one, that the teachers have the appropriate training with the software and the devices that we're using. We want to make sure that all of the homes have the appropriate devices and that they're comfortable with what we're asking them to do and support. Number three, we have to ensure that they have internet capability. And so those three pieces are instrumental in making sure that the remote learning does what it's intended to do, because we can't have 30% of remote learners not engaged, and we can't have 70% of remote learners holding their own. They have to grow, so we have to do as good a job as we can. So I anticipate on the remote side that we'll do a slow roll-in so that we make sure that we control all the variables.
And so I gather that we're, for the time being, hoping that that we won't have, a high school history teacher with no in-person class and 2 third grades cohorts that we need to marry them up to. I'm hoping we're trying to minimize that kind of stuff. And I get that we all have to be flexible and open to opportunities, but you can't shift a administration, a secretary necessarily to remote secretary work, and you can't shift, a lot of our people who are not the teachers, who have jobs that are in the classroom or in the building, that we can't necessarily easily shift if they're more at risk, for example. Do we have a plan for all those folks too, and how we're going to try to make use of their time and labor and still meet our needs for our buildings and whatnot?
Yeah, that's a great point. So first off, let me address this. And I met with Mr. McCullough, the field representative of MFPE, and also Mr. Greenfield 2 weeks ago, and we talked through this. It is my intent to maintain our staffing. Just because we are going to go to remote for a certain percentage of our student population does not mean that we are going to furlough or lay off classified staffing that wouldn't be attached to instruction. We are going to need these people in supportive roles in live instruction, which could be administering support to specific cohorts, to helping out with lunch, to helping out with transportation. There's many, many areas. We are not overstaffed in SD2 by any means. So we would welcome the additional support into the live instruction by the employees that you're talking about.
But we may yet still have some obstacles to finding something that the 65-year-old janitor might be able to do if being in the building just isn't in the cards, right?
We're going to do everything we can to support our people. I've referred to this in planning, Mr. Trustee Raffiani, as being a human being. We are in a pandemic that we have never seen before. There are people that are scared to death, and rightfully so. So as I approach this as the superintendent of the district, I'm going to be a human being, and we are going to work to support our people to the best of their ability. Are there some difficult conversations coming forward? Absolutely there are. There are some people that are going to have to make decisions about, is their personal health or wellness more important than maybe the tasks that are at hand? But we will do, and I will do everything I can to try to accommodate our people in a safe manner and still operate the district at a level that it needs to be operated and that students learn and that are safe. I can't answer every question with that other than we are going to be human beings with this.
And then lastly, just for Chairwoman Moen's accommodation, since she's getting antsy with all my questions, can you tell me, we've heard from Mr. Felton, we've heard from staff, we've heard from members of the LST, yourself, of all of these different things that we've tried to take into consideration and weigh. And of course, there is no perfect answer that satisfies everyone. But is there a topic that you are familiar with that people have raised or that has been part of the conversation that we just don't even know? It's not that we haven't chosen the solution that makes anybody happy. It's that we haven't even gotten to try to solve it yet. Is there anything that we're still chewing on and working on as to how we're going to deal with it?
Thank you for that question. I don't think so. If you want to refer to it as what's keeping you up at night, what's keeping me up at night is the marriage of remote need with teacher. That's the one that's we won't know until everyone commits to the remote on just exactly what type of dynamics we have. Now, I'm pleased to say that by including our online instructional curriculum, Apex, it's given us some latitude. So if we have a group of students that we don't have a licensed instructor for, we have some latitude with that. So that allowed me to sleep until 1. So yeah, that's the real only issue. And obviously in all of this, there are unknowns that we may think we know that we don't know moving forward. But I feel that's one of the reasons that I've pushed so hard to maintain what we normally do in as simple as format as we can, still maintaining the safety, because we know what the variables are. That's one of the pieces to this. It's not simple thinking. It's making things simple so that we can identify the variables. And then on top of that, it allows us just to maybe have some foresight into what could possibly happen.
Thank you.
Additional questions?
I have another one.
Jennifer Hoffman.
Okay, so over the draft document.
Jen?
Yeah.
You went in and out on us. If you could repeat your question, please.
Okay, sorry. As I'm looking over the draft document that we received, I'm looking at the remote learning classes that are offered, and I'm wondering if those students in high school specifically are taking those classes. Is it going to be scheduled, or is it going to be just randomly offered and they can sign up and do the schedule on their own? I'm just curious how that will work.
That information, Trustee Hoffman, is being designed right now. I can tell you this, that the remote school day will be different than the regular school day. But what we don't want to have happen in this either, and Becky can speak to this, the feedback that we received last spring that was a taxing toll on both the families and our teachers was there was no real defined school day. We had teachers online at 10, 11 o'clock at night, even later, right, and back online at 5, 6 in the morning, trying to catch families before they went to work, and then trying to catch families after they went to work. So it's our vision here to make sure that we define that school day so that there's more consistency for both the family and the teacher. So Becky, do you want to speak to that at all?
Yeah, just with the online learning as well, there's other capacities that kind of, as Greg spoke about, the communication piece and how key that is with the families. And so we're trying to define it within what a normal school day would look like, but it's not going to be your traditional day of how we would operate a building, if that makes any sense at all.
More like college courses.
Yeah, yep, very much so. The teacher becomes more of a facilitator in that situation. And so we want to make sure that we provide the proper professional development for our staff that's going to be in that role. But then also, laying out those expectations and being very clear with our families and the staff, setting those boundaries for themselves that, this is my time to be able to interact with you. And so those are just some pieces that I've been thinking about as I've been developing the student handbook as well. So
wonderful. Thank you both.
Any additional questions?
Just one quick one, Madam Chair.
Scott McCullough, you have the floor.
Now, I have to go back in my own history. I'm just curious, have policies and procedures been developed at the high school and middle school for dealing with student insubordination around masks and social distancing?
We have uniform procedures, but we're in the process of identifying that specifically. We did sign an MOU with our unions about masking specifically, so that there's very clear guidelines for employees, expectations for employees and visitors. And so we'll do the same for students.
Any other questions?
Madam Chair.
Mr. Leo.
Thank you. And this would be for Greg or Becky, both. I'm wondering, would it be beneficial, or could you envision it being beneficial to have a core of paraprofessionals who could provide supervision to these smaller cohorts during periods when they're not in front of a credentialed staff member for instruction?
I've looked at some ideas of having them be maybe even a moderator during their live session. So if there's questions that are being put into a chat, that paraprofessional could provide that.
Oh, sorry. Excuse me. Sorry. This is for live instruction, not the online. So in other words, if we're breaking up these classes, if we have paraprofessionals, who could facilitate a class being broken into, say, 4 cohorts instead of 2, would that be something that would be beneficial in your opinion?
Absolutely. And that's right. That's in line with what we're thinking. Here's the reality. For teaching, especially for elementary age children, that it takes an enormous amount of time to assist students with learning to read and math, especially in a tutorial support. So by using FTE that may have been involved, that aren't involved because of remote, then we fully plan to put them in classrooms with the administration and the instructional teachers and use them to the best of our ability to help students learn. Absolutely.
Great. Yeah. And I would, encourage you guys to look at additional hires of potentially college students who aren't going to be returning to their campuses in order to, spend some of that 7.4 as soon as we can.
Additional questions? Russ.
So a question specifically, well, 2 questions. Did I miss when this draft plan is going to be released to the public?
What I'd like to do, Trustee Hall, is I have meetings with our teachers tomorrow with this, and then I plan on having meetings with classified staff. As soon as that is complete, then I would, and there could be, adjustments made to the plan. Please know that it's probably going to remain draft, just because watching the virus itself, it causes us to shift significantly quickly. And so I'm going to leave the term draft on it, but I want to meet with our teachers and get their feedback, and then classified, and then prepare it for publication.
Okay, great, thank you. So with knowing that, then my question relates to the remote learning offerings. Last time we met, I asked about what honors AP classes would be available as part of this draft. There's a number of honors and AP classes that are part of the draft plan. Will this change based on the number of people, of students that enroll in these honors classes, specifically speaking of high school, of course? Or is what's in the draft going to stay there because we know we have enough teachers that can teach those AP and honor classes online?
So the answer is all of the above. One of the nice things about advanced type courses is there's multiple areas we can access them. So let's say that we have enough remote learners to justify a section of AP Physics. Okay, we would look for one of our instructors who may want to teach AP Physics online. If that doesn't work out, then we have the Montana Digital Academy that does offer AP and advanced courses, so the student could take it there. And then we also, with the introduction of the Apex online curriculum that we'll bring into the remote learning, we'll have access to advanced courses. So I think one of the things I'm going to give us permission to do in both sides, live and remote, is break the industrial model that we've been in, that has the noon whistle and the boxes, because the remote and the signing up for courses now, we've taken a lot of that away. And so it very well could, a student could have a period of live instruction and 3 periods of remote instruction and be signed up on MTDA all at the same time. So that's kind of how this will probably unfold. The one challenge will be in the vocational credit area, especially lab intensive classes will not be that easy. It just won't. So if we have a construction 2 home construction class, you can't simulate that electronically or remotely. It's just impossible. But we'll have vocational credit that a student can take remotely. So they won't be denied the credit, but they may be denied the specific course.
Great. Okay, thanks. And then a follow-up. Funny that you would pick AP Physics. That wasn't on the remote. That wasn't on the remote offering draft plan, but that actually begs a new question for, what you just talked about of having this consortium. If a class is not listed, like AP Physics is not currently on the draft, will there be opportunities then? We're saying, okay, student, this isn't part of SD2's plan, but here's an option for you to go take this and still receive credit for that class and be able to take the AP exam.
As long as it falls within the parameters of our accreditation standards through the Office of Public Instruction, we do have some parameters that we have to follow with that. That's a Class 8 certified instructor. So yeah, and from an accredited institution. But we know that. I don't see that as a problem.
Okay, so just to reiterate, you're saying that if we don't offer a class through remote, but a student wants to take remote, that isn't, there should be other options. There might be other options. We're not promising, but we're also not cutting it off and saying, no, if we don't offer it, you cannot take it.
Absolutely.
Great, thank you.
Yep.
Are there any other questions? I have a question, Greg. First, I really want to thank our staff, our teachers. They went from a traditional learning model that they have used for years and have been taught in for years with live instruction. And we asked them in a heartbeat to switch and do remote learning. And I thank them for all the challenges that they faced and those that they overcame. Now, as we move forward with 2 separate models with the live instruction and the remote learning, is there going to be professional development available for our teachers that are moving into the remote learning platform?
Madam Chair, that is yes. In fact, Miss Anthony and Dr. Oshesky are on in conjunction with Becky Carlson, but we have a wide training component that is heavy on the online. And we have a lot of teachers that are interested in getting involved with it because frankly, as I've shared with our administrators, our teachers have to be able to go remote at any point in time. A student could contract COVID in the class and be out for a period of time. The class could be impacted. The instructor could be impacted. The governor could put us back into phase 1. I mean, we just have to be ready to go remote at any given time.
Thank you. Are there any other questions? Jennifer?
I have a question with what you just said, Superintendent Upham. If a teacher or a student in the classroom comes down positive with COVID, then what happens?
Well, in the reopening plan, you'll see a sequence of decisions that will be made, and there will be more information. I really want to compliment Rachel Combs, who's our department chair for our nurses. She's working with our nursing department with those protocols in conjunction with the local health officials, but they will come in and dictate what we do. It's so unique individually that they, as Mr. Felton had shared, as far as close contacts and those types of situations, so they will take over and advise what to do.
Okay, thank you.
Mm-hmm.
Thanks, Jen. Anyone else? Dana?
Have we touched, or is it okay to touch on choir, band, those type of activities that are in groups and they are, singing or playing, and is that allowed or not allowed?
Miss Anthony, would you like to address the mitigating factors we're taking with music?
Absolutely. We've met with the music people a couple of times and have done a lot of research. Scott Ryder right now is looking at the level of intakes in all of our music room to make sure that all of the systems are working exactly how they need to be. The choir teachers have decided they're going to try to work on solos and ensembles at the beginning of the school year rather than everybody singing together. Students will be masked up for choir, but the choir teachers feel really good about that. Today we met and actually helped design a plexiglass piece that'll go around their conductor stands as well as around their pianos. Band students, it's a little bit trickier simply because with all the research that we've done, because of the airborne particles coming out of instruments, kids will need to have a bell cover over instruments such as trumpets, trombones, French horns. Flutes and clarinets seems to be the worst just because they don't have any loops in the instrument. And so there's actually instrument bags that the kids will play. Within their flute will be within a bag that the sound comes out really well. We've been working with the various distributors across the country as well as local people to make sure that we have all of those supplies. Students will wear their masks in band class until that they're playing, and then the mask will come off. We've actually looked at some masks that have slits in it so you can play your instrument through the mask, but those don't seem to have the best quality right now because they're still new. So actually, I've worked on a document just for the music teachers about what it's going to look like. Scott Ryder's making sure that they're going to have all of the foggers and things to clean up equipment. Music students will no longer be allowed to share music stands or music. So we're in the process of ordering all of those things, as well as tuners. Our brass instruments are really known for cleaning out their spit valves. And we have a plan in place with that, with a certain area of the classroom that they'll go and do that. Puppy pads, that way it'll absorb all of that. So I'm sure there's things we haven't thought of, but the music teachers have been extremely diligent in thinking through all of those things.
Thank you. Will we be supplying all these bags and things?
We were going to ask students to provide that, but honestly, they're so hard to get that I'm not sure that if we put it on the student supply list with reeds and all of those things, that they're going to actually be able to get them. So at this point in time, we are going to be supplying it.
Okay, thank you.
Any other questions?
Madam Chair.
Connie.
I tried reviewing the updated draft that we got just before the board meeting to see what the changes were, but reading 30 pages and tracking changes was kind of hard. And so I don't remember seeing anything about extended services or Quest or whatever current term we're using for that program. Are we making any strides towards trying to meet those children's needs in that regard?
We are. Miss Anthony, would you please address that?
So with the Quest program, one of the things that we're going to do is because we do universal screening of second graders in the fall, we don't actually start our program until October. So that gives us a few weeks to get through some of the hardships and some of the unknowns. But then we'll follow the busing protocols for the Quest kiddos that go to the Burlington Quest Center, grades 3 through 5. Instead of putting them in a third grade group and a fourth grade group and a fifth grade group and potentially mixing 4 to 5 schools. We're going to actually keep them in school cohorts. And so if you're a Meadowlark student, you'll have one Quest teacher. If you're a Washington student, you'll have one Quest teacher, and just doing our best to keep those cohorts pure. One of the things that we're working on is if some of our Quest kiddos do need to go to remote learning, because of the budget cuts in the spring, we cut a lot of our Quest teachers. And so I've actually approached them about, are they willing to do having a kid just be able to log in on their Quest day? And the Quest teachers were all about that. So I'm working with Brandon in technology to actually get a camera system that'll follow those teachers around so that those students will actually still have access to Quest if they have to be a remote learner.
Thanks.
Other questions? Greg, you briefly talked about, and I see that we have Mark Wall on, you briefly talked about the after-school athletics program. Can you or Mark talk about the decision that the MHSA has made, as well as the National High School Association, and how that impacts our students?
Sure. Mark and I have been, well, everyone's been in conversation, right? Mark, do you want to brief us on MHSA?
Yeah, the MHSA came out with their plan yesterday, and it's quite extensive. They have a tiered program, and the first tier, of course, is starting as originally scheduled. And so that's what we're in right now. Every sport has some restrictions. For example, volleyball, multi-team events will not take place. Large invitational meets like for cross country will not take place. We'll have to come up with a system to still allow those kids to compete in a different way. So on Monday, the state AA ADs will meet and we'll revise the schedule for all 5 of those sports. And then the only, as you see in our plan, it was broken into 3 areas. The first area is general practice procedures, and I'm fairly comfortable with those because our coaches and kids got a trial run over the summer, and they were highly invested in those procedures and did pretty well. I was a little concerned, and we're still a little bit concerned about our home competition procedures in terms of spectators. I think Mr. Felton had some concerns also, so I believe early next week, Mr. Felton, Mr. Upham, and myself will be meeting with a group of coaches and representatives from around the county to come up with a standardized spectator policy, hopefully to allow at least some level of spectators into our home events. We will be working really hard to televise through the National Federation as many events as we possibly can. We'll see how that works out given our schedule changes. The other part that's a concern is transportation. How do we transport our kids out of town on buses? And I believe we'll deal with those protocols with Mr. Felton also. Is there anything additional, Mr. Upham, you'd like to add?
I don't think so. I think, I wanted to start with the instructional models because that's the day-to-day operation. So right now the MHSA is sanctioning fall activities. That's the question that, most people are asking. Are we going to have fall activities? As it stands right now, it looks like it. There are some conversations in some other AA communities with county health officers about what that may look like and about what the number of attendees will look like. And that's the meeting that Mark is referring to. We'll have to decide in Yellowstone County, are we going to allow anyone who wants to come to a game, come to the game, or are we going to limit it? I can tell you right now, we'll probably limit it, especially early. As I referenced in our board meeting Monday, under the restrictive mode, the restrictive mode over the entire district is going to be restrictive, and so we'll have that conversation. But for the people viewing and listening, the plan is to move forward with fall activities. MHSA has sanctioned it. Now, does that mean that a board of trustees in one of our communities could say, whoa, wait a minute, absolutely, it means that. But as of right now, the information from the Montana High School Association is to move forward with fall activities following the safety protocols and plans that are in place.
So then how are they proposing to keep cohorts separate?
Well, it's a great question, right? So the cohort would be the football team. That becomes its own cohort. And then the football team goes and plays the team from Missoula. There is some risk in that. Again, there, like Mr. Felton said, there is. I mean, there's no reason to dance around it. There's risk in everything we do. So at this point in time, I'm supportive of fall activities, subject to change if the virus dictates that and open to it. And so that's kind of where we are. But that doesn't mean that everyone's in that same place, right? I mean, this is all at the discretion. So there are factors to consider in all of it.
So a couple of examples. For example, golf. Our kids from their own school will be playing together. We will not be, when they go to a tournament, they will not be playing with kids from another team or another city. So that's one way they're going to do that. For cross country, they're limiting any event to 200 runners. And then they have to, we can only have 25 at the start line at one time. And so we're going to have to, as a conference, we're going to have to figure out how we're going to run those events under those guidelines. But I'm fairly confident we can do it and still allow the kids participation.
Thanks, Mark. Are there additional questions from the board?
Question again. Okay, so I briefly looked through the MHSA, and am I understanding correctly that the athletes will have to wear a face covering when they can? So what does when they can mean?
We're going to encourage all student athletes and coaches to have their mask with them and to wear them as much as possible when social or physical distancing can't be met. So for example, middle school softball, when the kids are in the dugout, we would like them to wear their mask. On the sideline, one of the things they did for football is they increased the distance the kids can go along the sideline. So they're hoping that will allow them to keep physical distancing. If they can't, they should have their mask and they should be wearing it. They will not wear it during the strenuous activity, but we will encourage it on the soccer sidelines. We're going to encourage our coaches to wear them as much as they can, with the idea that when they're instructing, they can take them off and instruct and then put them back on.
Any other questions?
Sorry, no, not for Mark. Sorry.
Go ahead, Doug.
Other people have a question for Mark.
Yeah, I've got one, Mark, if we could. What about travel? So, I mean, it seems like, traveling from spot to spot is definitely a way to spread. Are there any protocols going to be put into place that are different for when our kids travel somewhere and when kids travel here from other locations? As far as temperature checks, are we doing any asymptomatic COVID checks? What sort of things like that to prevent spread across communities?
Right. Well, we put into our plan pre-checks on the bus before they get on the bus. So the plan was, depend on the number allowed on the bus, we'd enter the bus with a pre-check. We'd have a seating chart. Every person on the bus would wear a mask. Obviously, whenever we stopped, we'd have cleaning. We're working with the transportation company as to their sanitation and cleaning program. And then we would encourage, hopefully, if there is some level of spectators allowed and we have parents who can travel to games, we would encourage parents to bring their child home with them and reduce the number of kids on that bus coming home. We also have protocols in there in case a student or a coach becomes ill. we'll deal with that. And then, again, we're going to deal with Mr. Felton and work with the county to probably have a standardized plan for that travel. And in our AA meeting on Monday, we will talk about that cross travel, how we can mitigate some of that risk as teams from out of town are coming into our stadiums.
Okay, great. Thank you. Yeah, you're right. I did see that. Just said pre-screening, but okay, pre-screening involves asking the questions and a temperature check.
Exactly.
Okay. What about now? Is this going to be applied throughout the state? Will those traveling here, are they going to be doing pre-screening before they come to Billings?
That we don't know. That's one of the concerns, is how all this meshes with the plans from other towns. I do feel comfortable that our ADs and our obviously our superintendents and principals are concerned about the same things, and we will come to some agreements as to how it's all going to work the same for everybody.
Okay, so it could be potential if someone wasn't willing to live up to the standards we have, maybe we choose not to invite them to town and play them possibly?
That could be the case. We've talked to the MHSA. I talked with Mark Beckman a little bit about that, and I think their guidelines did cover some of that. But I do think some of that needs to be vetted through the ADs.
Great, thank you.
Mm-hmm.
Raffiani, did you have any other additional questions for Mark or Greg?
I just want to know, I guess it's a question for Mark and kind of Greg, just in relation to all the extra facilities that we have, like the locker rooms, the library, the secondary and tertiary places that maybe haven't been addressed specifically in the reopening document. That's kind of one of those things. I know I asked you, is there any known unknown that we haven't answered yet, or whatever, but is there a plan in place to deal with is paying special attention to common areas, to resources that are by definition hands-on and those sorts of things?
Yeah, I'm not really concerned about the practice times, and our coaches and kids are invested, so they will help with some of that cleaning. My concern is game time. So we will have a custodian on duty through all the games, going through bathrooms, a concession stand. We are, in terms of the concession stand, we're working closely with the Yellowstone County Health Department on the guidelines that we'll have to follow. Press boxes, those types of things, they all need to be cleaned on a regular basis. And so we'll be working with our activity coordinators at each school to figure out how we're going to do that. It is quite a chore, but we'll have a plan.
I have authorized Mr. Ryder to hire additional FTE as needed within limits, obviously, to address the increasing demands for disinfecting and such. Scott, do you want to maybe talk a little bit about some of the facility work that we've addressed in conjunction with air, since you have the floor at this time?
Sure. So in regards to the air, Greg, is that what you were talking about?
I would just start with air and then talk about the increased presence of disinfecting and cleaning from your group.
Sure. We've had the temperature control people, our staff, checking out their handling units and verifying that they're all putting out what they need to put out or what they're built to put out. We've looked at ordering new filters for all the schools, a different style than what we normally get. We're ordering FAR 3030 filters, and we currently use electrostatic filters in the classrooms and the unit ventilators, and they work very well. So we're going to increase cleaning on them to 3 times or 4 times a year instead of the normal 2 times a year. So every 3 months, unless they're looking dirtier when they go in, then they'll be done more frequently. It depends on where they're located and how much air they're moving, and so there's no set date for any of them. But we're increasing that. The air handlers are being scheduled to come on an hour earlier than they normally would have, and they're going to run much later, depending on the activities at the school, where normally they would shut down When the students left, we always were conserving energy, and so things were pretty tight on the scheduling. So we're increasing the occupied time on all the buildings to run during the time we have staff working there, the custodians, through the evening, and shutting down after they leave. And each building's a little differently on when they come or leave, depending on the staffing at that building. So there's no set time for that either. It's going to be building specific. The custodial staff has been cleaning and disinfecting the buildings all summer. They've done their deep clean and have done a great job at it. And they continue to disinfect every day as people come in and out of the buildings, depending on what's going on. We've ordered and started installing the pump sprayers for every classroom. The custodians have picked them up at the warehouse. Just about all of them have been picked up right now. There's been a pump sprayer for disinfectant ordered for every classroom. They will be handy and available to everybody. What else? We have, we're planning on disinfecting twice a day at the schools, once in the evening after the students leave and staff, and then another time midday. And that presents quite a challenge to get into those classrooms. It takes about 4 minutes on average to, I don't want to say it's fog. It's two types of disinfectant that we use. One is our regular disinfectant in a pump sprayer, and the other is an electrostatic, the EvaClean, the one that Craig was struggling to come up with earlier. It's a EvaClean machine. It's an ionized sprayer, electrostatic type sprayer, and they work very well. We have ordered 36 of them back in February. We've just about got all of them in. They are a hot item all over the country, and shipping is difficult everywhere. We have ordered another 40 of them with an expected date of October for those. So in the meantime, we have the pump sprayers with our disinfectant as well. We've installed plexiglass shields in the schools to all the main entrances and the offices to the schools. We're also waiting for the principals to return back and see if there's any additional areas that we may need to get them installed. They are also about a 3-week time on those. We've ordered the hand sanitizer for every classroom as well, and for the offices. We'll have that in about a week. Should be here.
Scott, sorry, very specifically though, do we have any kind of a plan for where kids are touching the same thing over and over again, like sharing books, for example? That's the weird one that I don't see how it is. What are we doing about something like that?
That's a great question. Now we are going over the multiple touched areas, doorknobs, light switches, handrails, that type of thing. Those will be constantly disinfected throughout the day as well. Books are a whole different issue. We can spray them with the sprayer, but it kind of wrecks the pages in the books too. And I don't know that that's a great deal for that. I'm not sure how we're going to address books yet, but we can spray them. It just isn't the best thing for them.
Miss Anthony, would you please address what we're going to do with instructional materials?
Absolutely. So for most of our instructional materials, each student has their own book within the elementary classroom, so that won't be an issue. At the middle school level, we are working on getting enough books so that kids can be assigned a book, and then that way they don't have to share. With the library books, we have done lots of research. Again, and it looks like 72 hours seems to be the best amount of time for library books to sit before they're reshelved for teachers or for students to check out again. So we have a system in place with the librarians to make sure that those are off the shelf and making sure that they're safe before other students can touch them.
Thank you.
Thanks, Kim. Anyone else? Jana Hafer.
Water fountains. I know we like to promote hydration for all our students. Are those off limits and everybody's required to bring their own water? How are we dealing with that?
The water fountains have been turned off. The bottle fillers at the water fountains, where possible, have been turned back on. The plumbers had to go in and replumb equipment to allow the bottle fillers to run separate from the drinking fountains. But the drinking fountains themselves have been turned off.
And we do have a hydration system. Each team is required to give us a plan for hydration. We have purchased some large team hydration systems, so that's taken care of for activities too.
Thanks, Mark. Additional questions from the board?
I have some questions. So this is more specific to classroom. I know we talked last time about cohorts. I don't believe we've talked about that this time. So I'd like some more definition, specifically thinking about, what do we expect the average class size to be in middle and high schools? And then how will cohorting work? Like, what does that actually look like? And what are the benefits of cohorting? And then, I guess my concerns are that if we have a group together, I assume that group's going to change. You can't have the same teacher teaching the same cohort because they have different classes in middle school and high school. So what are some of the thoughts behind that and some of the technical details, if you will, of the safe distancing so that parents can make an informed decision?
Sure. Thank you for the question. So we've had this conversation with our administrators prior to them leaving for the summer. And what I encourage them to do, so cohorting would be to create as many like groups as you can, and especially in the restrictive mode that we'll be operating in initially. I didn't put a time period to it, but I just said, create groups that are going to be themselves to the best of your ability. So middle school and high school will be a challenge. There's no doubt about that. They're working on that. I don't have specific answers to what each individual building is doing, but I know they'll regionally cohort, starting, with a group of students. This is where we'd like you to enter and exit the building. Try not to mix them during lunches to the best of their ability, and then create smaller cohorts. So a classroom would function as itself, in that scope. But again, those students are going to get up and move. So there's challenges with cohorting in the middle and high schools, other than trying to do the best they can with regional parts of their building and also, grade levels. High school will be more of a challenge because there's sophomores and juniors and seniors in the same class. So what we would say to them to the students is try and sit by the same person all the time. There'll be assigned seating. It'll be controlling those variables, but in the end, it's extremely difficult to do in the middle, not so much in middle, but in high school, but not impossible.
And so a follow-up to that, not this question itself, but all of the questions that are coming in, we've received as board members a number of questions. You've received hundreds of questions, I'm sure. Are we building an FAQ, frequently asked questions list, so that as parents come to fill out this form of remote versus online, they can look through that instead of, we are.
Yeah, I've reached out to Kinetic Marketing, who's been very instrumental in our communication, and they are prepared to go after the FAQs. We did it last year. Ms. Koch did it, did an excellent job, but I need an outside source to address because of the volume of questions that we're receiving.
Okay, cool. And I assume that part of that would, what I think people would like to see is taking out what you are sharing during your lunch Facebook meetings. What questions are you answering? Because we have to go watch those meetings now to receive these answers to questions.
Yes.
So they'll be extracting those.
Much more formalized. Yes.
Mm-hmm. Great. And when can we expect that? Because now we kind of need those answers before people make a choice, right?
Yeah, I think within days. The microsite is constructed for us, and so it's just a matter of filling the information now. So we're ready to go. Yep.
Great. Thank you.
Mm-hmm.
Anyone else? Okay, Greg, I'll throw it back to you.
Okay, so I thought I would I wanted to talk about the instructional model first, just because it was the one that was going to generate the most questions. So back to the same conversation we had on Monday night's board meeting. So the safety requirements, and I don't want to minimize this, and they're in the document itself, and that's the face coverings are going to be required. They are very effective. We will practice physical distancing to the best of our ability, knowing, of course, when we're in schools, physical distancing is a challenge at best. I've referred to it as an oxymoron. But I think with the amount of time that we've had, we can do a better job in creating cohorts that we can control, and the physical distancing, and then the hand hygiene. I'm saying we can't lose sight of the importance of this, and just it becomes noise. It has to become what we do every day. The restrictive mode of operation that I've asked our entire district to open up with basically is essential workers only, or who we deem essential workers only in the buildings. No large gatherings. You'll see that in the document. No field trips, no open houses. Now, there has been talk about virtual open houses. That's completely fine. Anything that we can do virtually, we will do. Guest speakers, all of that. Anything that creates a mix that we don't have to have, we don't want. So that'll be different in some buildings, more in others. So the restrictive mode of operation. And then I covered the instructional models and transportation. With transportation, we set a goal of 1 student per seat. Sandra, I believe, is on, and she did speak to this in our previous meeting, but for those that didn't have the opportunity to see it, in the elementary, we feel we are pretty good. We're not too bad. I was actually surprised, and Sandra did a very nice job of rerouting all summer long to try to add more space. Because remember, when you staff your transportation, you want as many people on the bus as you can possibly get. And so that being said, what we're saying to them now is get as many people off the bus as you possibly can. And so there's some challenges with that. But on the elementary side, I think we're pretty good. Sandra, are you on still? Okay, that would be a no. So middle school, it'll be challenging. We will seat individuals in permanent seating, permanent assignment. We will seat by their household. But middle school, as I shared, in order to get to the goal of 1 student per seat in middle school would have required 10 additional routes, 10 additional buses, 10 additional drivers, and not feasible. So we're doing the best we can with that. We will encourage families that can provide transportation for their students to do so if possible. But the middle school will be the challenge. Why? There's more middle school students riding the buses than elementary. And then on the high school side, Ms. Baker shared with me that she felt that we were pretty close to being able to have 1 student per seat with the restructuring of the routing. And so elementary and high school, I feel pretty good on. Middle school, we're going to be tight for sure. So the safety face requirements and all of that will be required. Face coverings will be required, and that'll help for sure.
Have you considered the use of the Metrobus that a lot of the middle schoolers and high schoolers use, and what the stipulations will be for them riding those buses?
Well, we do that now, and so we just continue to encourage that to the best of our ability. I haven't been given the percentage of our riders that ride the Metrobus, but I do know that we have quite a few. So that will help. But then again, you don't want quite a few on that bus either. So I don't know what the occupancy percentages are on the Metro buses, but I surely can find out. We talked about activities quite extensively, and then the other point of emphasis in the document is human resources. And Katie's office has been diligent in working with our employees. We've had approximately about 50 employees that have come in and expressed concern about health issues, either themselves or members of their family. And so, Katie, maybe do you want to walk through kind of what those conversations have been and what we're doing?
Yes, thank you. So I have been getting contacted by staff, mostly certified staff. And as I've been sitting here, I'm seeing more emails coming in. We're under 50 that have requested accommodations either for their own serious health condition or because they live with or take care of somebody with a fragile health issue. And so we're working through that through the ADA process. And and working with the union on, helping navigate people through the process. The union's helping answer questions if they have them, as well as myself. I'm trying to think what else. Yeah, I just think it's, as we get closer and especially after this reopening document, it's just important for our staff to know that they can reach out to me, that I can walk them through the process, answer their questions. And then for the people that do qualify for ADA or the family member serious health condition, we are putting them on a spreadsheet that is shared with Brenda and Randy, and they will use that, and Becky. They will use that as they start putting the puzzle pieces together for staffing.
Thanks, Katie. Anybody have questions for Katie? Well, you got off easy.
So the next,
back to you, Greg.
Yeah, so the next big point of emphasis is food service. And I compliment Sid Taylor and his team, and have multiple times. We will be able to offer lunch services in options, and you see that in the reopening guide at the schools for both live instruction and remote instruction. We just got clarification earlier this week on the remote side that we will be able to offer breakfast and lunch for students that are involved in remote settings. They will have to come to pickup sites, and I believe the pickup sites will be in the middle schools or will be located regionally like we did last year. So that's a really good thing. I was really pleased to see that happen, because I didn't know, since we were running a dual platform, if the students in remote would be eligible for lunch and or breakfast and lunch, and they are. So we can I can have Sid give a full presentation on the lunch program, because I think it's important that we see that. It's a big deal, especially what we saw last year with the backpack meals and students who were placed in remote, our students who were in remote, and then the backpack meals just went through the roof as soon as the economy started to be challenged. So other than that, in the document, I guess what I'd like to do is moving forward is come back and maybe address specific areas of it that people have questions with moving forward on our August 17th board meeting. Again, having updates and so on and so forth. But from that perspective, is there anything else you would like me to cover in the document itself at this point in time?
So questions to the board members as you've reviewed the draft document for the reopening of schools. Are there areas that you would like to have Superintendent Upham explore further, or were there omissions that you would like to have him explore and be included? So with that, I'll throw that out to the board. Aside from that, you will be giving us a continual update, and at the board meeting, giving us again the updated version after you meet with the teaching staff to get feedback, and assume there'll be modifications to the reopening plan as we move forward, and as you continue to work with the health professionals, and as we see continued evolution of the disease and information forthcoming.
That would be correct, Madam Chair.
Brian, you are off mute. Did you have a question or comment?
I did have a question. This is more for, students with 504s or IEPs. And reading through it, it does mention that, their individual needs will be addressed. Is that something that parents with children or students that have those learning plans, is that something they'll receive contact from those teams before the school year begins to kind of help them navigate what's best for their situation?
Yeah, sure. Judy, would you like to address that, please?
Yes. As you
can see in the document there, it does say, hold on here. In the document, it does talk about a remote learning plan. So students who are opting for the remote learning plan will meet with the IEP team and take a look at the IEP goals and objectives that are in there and how to best meet those goals through that remote plan. So it'll be an extensive meeting with both the gen ed teacher, the remote teacher, the remote special ed teacher on how to meet those needs and if in fact they can be met remotely. So, like everyone else, not all of the coursework can be met remotely for many students. So they'll need to have a discussion as to what is the best way to try to meet the needs of that IEP.
Okay, thank you. I think, and so this follow-up question to that then, they'll have the same choice, the traditional in-class learning or the remote learning. Is there going to be contact maybe before to help those parents navigate what might be the best choice for them? So, like it says, obviously if they go the remote learning, there's a plan. If they go the traditional learning, there's a plan. Will someone from either of those teams reach out to them prior to the school year or have contact with them to maybe help them choose what plan would be best for their student?
That's a great question. And as we've been kind of watching through the summer, I've had some parents already reaching out to not only my office, but to those building administrators. And specifically, many of our high needs parents have already reached out to that classroom teacher. So those conversations are taking place right now.
Okay, great. Thanks.
Are there any other questions? Greg, are you in the point of summarizing and wrapping things up?
I am, Madam Chair. First off, I'd like to thank the trustees for their questions and input. It's critical. I also want to recognize the executive directors for their work in this, especially Ms. Koch. She was the lead person on the edits and the organization and the writing of the material. It's an excellent job. I just want to publicly thank executive directors and recognize Ms. Koch's excellent work. Obviously a draft in process. I welcome continued conversations and we'll move forward as we watch the virus and the response to it. So that's it, Madam Chair.
Thanks, Greg. I'd like to also thank you. I'm sorry for all your sleepless nights, but I appreciate your heartfelt commitment to our district, to our students, to our parents, to our teachers. You're carrying an awful lot on your shoulders, and you've done a really outstanding job, and it is very much appreciated by us, by our board. I want to thank the board for being diligent as we've navigated this from March on forward. The administrative team has been phenomenal as they've come together and worked. I mean, just hearing as the plan is laid out, it's a plan, as you said, that's in draft, but it has touches from every different executive director as they want to provide what's best for students. And then the folks on the ground, the teaching staff, we are so thankful for them. We value them. We value their time. We value them being nimble and being on the front line. They are our essential workers. They're there for our kids, and we appreciate that. And then the staff that are in there working on the buildings. It takes a village, it takes a district to educate our kids, and you need to know that you are valued by all of us. So with that, if there is no objection, we will adjourn. And I'm not seeing any objections. So thank you, folks. Be safe, be healthy, and we'll see you soon. Bye-bye.
Let's see. I can't think of her name right now.
It's called Mr. Falker. It was kind of like a middle school sort of
that one, yeah.
about a student who's handicapped, and she was in a